and welcome to another episode of the Two Abdullahs. This is a special exclusive series on the epileptic prophet, part 2. So you are going to be in for a treat today. Today, we're going to be deconstructing Farid al-Bahrani and his silly arguments that he's been making against our series. He had a 2-minute video where he claimed, I've debunked Abdullah Gondal in 2 minutes. Let's see. We're going to go through that. We're going to go through other content of his, and we're going to show you that these claims are, I don't know what to call them other than straight up lies, because they are so clearly wrong. They're so clearly false claims. And we have lots of evidence for you. And as well, we have a special treat. We have Dr. Ali RIZVI, who is going to be joining us later in the stream in about an hour or so. So wait for that. And over to you, Abdullah Gondal. Do you want to go through and summarize the previous episode before we get to the next one?
All right. I hope everybody can hear me. Welcome back to Epileptic Prophet Part 2. So this one is going to be better than the last one. I promise you that. Before I begin, I'm going to say a warning to the Muslims who are watching this, that this will shake your faith to its deepest core. With that being aside, we will delve into Farid being debunked in the most amazing fashion, where all he does is chronically, pathologically manipulate and lie. But with that aside, I want to actually do a quick preview of what we discussed in our previous episode for those who missed out on. So previously we discussed how Muhammad's mother had hallucinations, and this could be related to genetics and epilepsy, how Muhammad had a traumatic birth, which perinatal factors that are very important for mental health issues later in life. Muhammad had a traumatic childhood, losing his parents earlier in the age of before his dad before he was born, his mother at the age of 6, his grandpa at 8, and so forth. He had seizures in his childhood that were reported by adults who suspected him of being afflicted by some sort of demon possession or insanity. Muhammad was exorcised for evil eye before the Quran, as he had seizures. Muhammad also had started seeing things, hearing things. He tried to commit suicide. The first revelation was a generalized seizure. This is what we discussed in the last episode, and a bit of what psychosis is, some introduction to epilepsy and its symptoms. Now, today we're going to get into with slide 71, and we're going to start off with the post-ictal psychosis of Muhammad. So last time we touched about how psychosis can take a schizophrenic-like form. There's different types. There's interictal, post-ictal, periictal, bimodal psychosis, and the classification of these types of psychosis is beyond the scope of this presentation, but it is an ongoing debate in neurology as to if these are just clinical distinctions and or actual ones in real life. With that aside, we will start to get into the thick end of things, because this one is going to be a wild ride. We're going to see the most explicit imaginable evidence that you can think of. So before we go, think of if there were 7th century people who would have seen Muhammad have seizures. The most explicit form you can imagine that they would have reported those words, we will see exactly that and more today. So let's get the slides on and let's get started.
So just a clarification before we get started, one thing. Keep in mind that this is a little bit more nuanced than just saying Muhammad is crazy. A lot of times people will dismiss the idea outright when someone says Muhammad is crazy, because they think of a crazy person, right? Like severe, insane person that doesn't know what's going on, seeing things. With Muhammad, it's a little bit more specific. We're talking about a specific set of criteria that match the symptoms that we're going to go through. And you're going to see that it's what we have here is an example of a man that was living his life, and there are people today who have the exact same symptoms. They're able to live their life. They're able to come up with great tomes, great artwork, great books, right? Like, we're going to go through that. I don't know if that's today or not, but you're going to see that it's not like Muhammad was some babbling maniac that was wandering the streets. That's not what we're saying. So it's more specific than that. But what you're going to see is that the evidence from the Sirah, the Hadith, and the Quran indicates very strongly a very high possible diagnosis of temporal lobe epilepsy. And we're going to we're going to go through the details. So just to get that out of the way, you will see like something good is coming. Okay, so gonna present. All right.
Perfect. So the first slide here we have is going to be post-ictal psychosis of Muhammad. Can you go to the slide prior to this one? 71. And what we see here on the right side is I'm going to, pardon us, we're just having some issues with the slide. But so we're going to start with slide 71. And this is going to be talking about the post-ictal psychosis of Muhammad. So there we go. The state after the seizure is where most of the delusions and hallucinations happens, i.e. post-ictal psychosis. This means not each seizure event equates with a revelation, but a seizure can trigger a psychotic state lasting for days or weeks. That psychosis can induce more inspirations and revelations. During this psychotic phase, patients experience thought disorder, auditory and visual hallucinations, grandiose and religious delusions, religious conversion experiences, and suicidal tendencies, attempts of violence. Muhammad exhibited almost all of the above. Now, on the left side here, we're going to just read what it said. So combinations of thought disorder, auditory and visual hallucinations either may predominate. Delusions, grandiose, religious, persecutory, paranoia, affective change, mania, or depression. Muhammad suddenly got very depressed, tried to kill himself. Auditory or visual hallucinations can predominate. He would see the angel, hear voices, the angel talking to him, especially would go up the mountain. Compared to patients with ictal psychosis, those with PP are more likely to suffer visual hallucinations, grandiose, and religious delusions. So this is the point where Muhammad, after his first revelation, had a pause in revelation for a while. And during this phase, despite the dormancy in the revelation, he'd still see the angel, hear his voices, and try to kill himself, and would be going through these symptoms as described. He would have pressured speech and illusions of familiarity, deja vu, deja rev, the dreams, and those things we discussed in part 1. Now, by contrast, referential, perceptual, and persecutor delusions, as well as auditory hallucinations of voices, are more common patients. They go into a lot more details. Here it says religious and violent behavior can be prominent in PP. Most sudden religious conversions in epilepsy patients occur during the post-ictal period. Both verbal and physical violence can occur. Now, this is an important point. The verbal violence we're talking about is the aggressive nature of Muhammad's verses that he was composing. We will get to this in a specific section dedicated in part 3 or 4. But what we're just going to mention here, the first 5 surahs, if you take per the order of revelation, you get a staggering number where 80% of the verses were just threats towards the Meccans. So what you're trying to see here is exact manifestation of what Muhammad was going through. Then we see that they talk about suicides being prominent in this post-ictal psychotic phase. What did we see? Muhammad trying to kill himself, and it was numerously reported from Bukhari, Muslim, and a bunch of other seerah literature that we went through. In fact, one of the guys at the bottom of this picture said that he jumped from a stairwell from the 12th floor of an epilepsy center, right? So this is an interesting one where Muhammad was trying to throw himself from the top of 2 different mountains. Here we have a guy trying to throw himself, and he did throw himself. This being aside, now Farid and his cousin said that, well, seizures like this, post-ictal psychosis requires, as you will see in the next slide, a buildup, a cluster of seizures, or a high frequency of seizure-like states to occur, or a large generalized seizure. And after that, you'll see the post-ictal psychosis come in. So now when we go to the next slide.
By the way, what are you quoting from here? Is this a medical paper?
Yes. The reference is right at the bottom there.
Okay.
And you can look it up if you want. This was also referenced in my initial presentation. Now, on the next slide, we kind of go through a little brief thing. So on the right side, we see post-ictal psychosis has been estimated to affect 6 and 10% of people with epilepsy. It involves psychiatric symptoms occur within 7 days, usually 1 to 3 days after a seizure or a seizure cluster. It's not just a cluster, but it can also be one large seizure. Okay, these symptoms may include delusions, depressive or manic psychosis, or bizarre thoughts and behaviors. That's exactly what we see in Muhammad initially after his big generalized seizure in the cave of Hira. They are more common after secondary generalized tonic-clonic seizures. What we learned in the first part was that Muhammad in the cave was swooning, his body was shaking, his chest was cut open, and he had a buildup of these things, and then he had the choking sensation, and he trembled, and he had a generalized seizure. A very interesting detail occurs right after is insomnia is usually the first sign of post-ictal psychosis. Surah 73. Ya ayyuhal muzammil, qum al-layla illa qalila nisfahu. And he goes on about what? What is the second revelation? You're standing at night praying a lot, you're not sleeping, and all of this. Now, if you read on the side that in the right screenshot, it said that you can in fact start treating post-ictal psychosis as the first sign of insomnia appearing, and insomnia is a prominent sign, and this is the second revelation, or the first few surahs that indicate. Now, I'm just going to read out what it says on the left side. Muhammad experiences increased frequency of psychotic episodes and seizure-like events prior to first revelation. This included him hearing rocks and trees talk to him, heard voices, had his chest split open, deja vu, deja rev, a choking sensation, and a generalized seizure. He fainted, he trembled, shivered, and displayed immense confusion while suspecting his own sanity. Revelation stopped, but psychosis persisted or restarted after a short dormancy. Muhammad had his religious conversion experience, like they told earlier. Post-ictal psychosis is during which religious conversions happen. Before this, Muhammad was having these kind of experiences, but he was still questioning his own sanity. And prior to that, we are also told in some of the other books that he was full on having what you would call exorcisms performed upon him because he was suspected of being afflicted with magic or possessed by a genie. We see the post-ictal psychosis, Muhammad's urge to kill himself, and Muhammad's psychosis eventually turned into a chronic interictal bimodal form as seizure activity resumed and increased in frequency. All right, so with that aside, now we are going to go to the next level.
So I'm going to point out one thing here, which is that when we're looking at symptoms of Muhammad and we're seeing one by one how they connect, with just one or two, it could be a coincidence. But when you see point after point after point directly connecting the symptoms of the seizures and the post-ictal psychosis and what Muhammad was experiencing, it gets very difficult to say this is not what he had, and rather he was talking to an angel. Because those are the two alternatives. Either he had something happening in his brain, or he was actually talking to an angel. So ask yourself, which one seems more likely, or possibly both at the same time, which is a little bit nuts, but anyways.
So this is an important little snippet from Dr. Didi's book that we've been referencing throughout this series. He's talking about on the left side, I just want to point out something very important, that it was not until the late 1970s that these phenomena were finally clarified by scientific medical research. So till the 1970s, complex partial seizures and all these things weren't very well understood, even by neurologists and stuff. And expecting people from the past, especially Muhammad's era, people to know about the details is quite unrealistic. As the study has developed, complex partial seizures, previously called temporal epilepsy, and the naming keeps changing with years and as time goes on. Like he says before, that's called psychomotor epilepsy, is the one neurological disease with a confirmed anatomical localization that has been associated with functional psychiatric disorders. Okay, he goes on that what ends up happening is interseizure psychotic or crazy states seen as in CPS patients, complex partial seizure patients, resembles a schizophrenia or madness more often than chance would allow. This phenomenon with CPS is more likely episodic rather than chronic, as with a truly mentally ill person. The differentiation can be ascertained only by professionally trained people. The ordinary person would most likely not understand the difference, even in the modern age, and certainly not in ancient times. Then he talks about interseizure personality characteristics. The term ictal refers to seizure, hence interictal means between seizures. Emotionality is deepened and is more intense in these patients. Feeling states such as elation and grandiosity, or conversely depression and discouragement, even leading to suicidal rumination and attempts. There is a phenomenon of anger and aggression manifested in these kinds of patients that is obviously more than normal. This kind of person may commit violent crimes such as armed robbery and murder. The murder may be direct or solicited by the epileptic, thus indirectly expressing his hostility. This indirect hostility is important because Muhammad ordered the killing of numerous hundreds of people. Maybe possibly the number that he had explicitly ordered to be killed is in above 1,000. If you take higher estimates of Banu Qurayza. But the point is, there's also the solicited thing, and you'll see the verbal aggression I was talking about, the constant threatening with hell if anybody questions you, and we have a different section dedicated later on. Such patients tend to marry late if they marry at all. They may exhibit immature forms of sexual expression, low libido, and they might have hyposexuality, maybe interspersed with episodes of hypersexual activity. So you'll see that Muhammad, in a time where early marriage is apparently the norm, and he's this handsome guy whose face is like the moon, can't find a wife till he's 25, while other guys are getting married at like 12, 15, whatever. And then he ends up finding a wife, and he only managed to find a 40-year-old, twice widowed woman, right? So you see that there's this idea of hyposexuality. But then after she dies, when he's 50 years old, in the last 13 years of his life, Muhammad ends up marrying, in some books, the numbers are between 15 to 18 women. Now think about it. The older you get, your sexuality diminishes. But this is mentioned in detail in a full section we will come across with detailed interviews from Dr. Abbas. Now we're going to move on to the next slide. Where
Question.
Sure.
So about what does it mean when it says, comparing this to interseizure psychotic or crazy state versus the how it resembles schizophrenia? What's the point they're trying to make there?
So they're trying to tell you is that the psychotic state that the epileptic might find himself in, to an outsider, might be indistinguishable from the schizophrenic psychosis that you see in schizophrenics, especially to untrained professionals. And in the first part, if you remember, we went through a bunch of papers that were referencing this, that it looks almost identical at times, the psychosis. So when you hear people who sometimes say, oh, he might not have been epileptic, but he might have been schizophrenic, it's not because they know that they can differentiate the two. It's because the reason that they cannot differentiate the psychosis of epilepsy and schizophrenia. Hence, they appear so similar. And this is the thing we will see again later on in the presentation when we go through his delusions and his just absurd behaviors, which can only be described as psychotic.
Got it. Thanks.
No problem. All right. I'm just going to listen to this video.
Okay, give me a second to
mute my mic as well.
In the sense that he has gone to Taif, has been rejected. It has lost a wife. It has got so bad that even his own people, by then he had about 100 or so,
Right.
Are beginning to doubt. I mean, if you're a prophet, do something.
Right.
And then he goes there, kids throwing a stone at him, and
Right.
in just, the most awful feeling that the person has.
Failure.
But if it is from God, it cannot be a failure.
Right.
So there has to be a reason.
Right.
So then he sleeps, and then that is when he sees the jinns. So the hallucinations, dreams, delusions, whatever you want to call it, is compensating for the failure, the feelings of that time. Just like Miraj. Miraj, what is higher than going to heavens and meeting with God? I mean, there is just nothing higher than that. That is just about the best which can happen to someone who was an orphan as a child in Arabia at that time, and what they used to call them, and all of the bad things. And by the way, it is interesting how many references in Quran is to orphans and treating them properly.
Right.
All right. So that was an interesting little snippet from Dr. Abbas, where he's talking about how delusions can be exacerbated or exaggerated because of the trauma the person might be facing in real life. And in fact, a lot of times, the delusions the person might go through are a direct result of the trauma from real life, or a coping mechanism. So for example, what he mentions here, and this is very, very important, How was Surah Jinn revealed? The whole story is weird. Muhammad goes to Taif. I don't know what he did there, to the point where he was pelted by stones with people running through streets after him. He should have probably did something stupid that he doesn't want to tell us. Covered in blood, feels rejected, feels depressed. Of course, the genies came to accept his Islamic religion, even though the people of Taif had rejected it. Of course, the genies came now, and of course, the genies listen to the Quran and says, oh, this is such an amazing book, and we're going to believe. The Taif people didn't believe. Hey, at least the genies did, right? And there's this hadith later on we'll come across where Muhammad was reciting Surah Rahman to genies, and the genies loved it and whatnot. This, again, he says that with Mi'raj was during the Meccan phase where he was being called crazy and they bring us a miracle. And during this whole phase of hardship, he went through this again, where he came up with this Mi'raj story. So this is a very interesting point, and you'll see what he's trying to say is own failures or own lack of self-confidence, stuff like that is compensated by delusional thoughts like Muhammad would create. With that said, we are going to go to the next section, which is Muhammad is called crazy and possessed. This one is very, very, very important to understand, because I think the Meccans, when they first saw Muhammad going through this, they hit the nail on the head when they said something's neurologically wrong with him. So Muhammad was called crazy and possessed a lot, like to the point where you have 16 verses or something. And that on its own is a staggering amount to be mentioned in the Quran if it wasn't a big deal, or if it wasn't a big accusation against him. Why would they mention it too much? So now we're going to go through something about what the Islamic theologians and what the Islamic historians think about what causes epilepsy. And then we're going to link it all back to how Farid said that epilepsy, sar'a, and how he debunked me in 2 minutes. But let's get to the next slide. So firstly, we see here is that Muslim scholars are very openly telling us that epilepsy is in fact caused by jinns, okay? This is absurd on its own. So let's start from the left, page 51. The people of the troop adopted a stance of accepting the texts which speak of the jinn entering human bodies. Okay, stories of jinn entering human bodies are many, right? Ibn al-Qayyim said there are two types of epilepsy, one caused by evil earthly spirits. On page 52, Ibn Taymiyyah said the fact that the jinn can enter human bodies is proven according to the consensus of Ahl Sunnah. Oof. The jinns can enter the body of the epileptic and he says things. Now, this is kind of ironic where, funny thing is, Ibn Jawzi, in his book, he mentions a part where he says the angel would enter Muhammad's body and take control of it. We'll get to that later on. This is a very interesting anomaly. And then on the right side, they say, Imam Qurtubi says that the verse shows 275. Those who deny that epilepsy can be caused by the jinn and that is caused only by physical factors and that the shayateen cannot affect man or cause insanity are wrong. So you see that these scholars are actually arriving hundreds of years after Muhammad, 4 or 5 centuries after Muhammad, and still they're coming up with these absurd notions of what causes epilepsy. This is from the book, I think, The Jinns and Human Sickness. And this is actually written by another doctor who has some psychology degree. Then he says, Imam Tabari says what is meant by that is the shaitan beats him in this world, causing insanity. The point they're saying is Satan or jinns can cause insanity, which leads to the word, what? Majnoon, demon possessed. If you're using the word demon possessed, demon possession is a synonym at times for epilepsy. Who said that? I did not say it. It's Muslim scholars that said that. This leads us to the next slide, which now we'll find out that in modern Saudi Arabia, this was, I think, 2012, 2010, very recent, this paper. It talks about, on the left side in the abstract, epilepsy has been linked to divine, demonic, and supernatural powers throughout its long history. This study was conducted to explore if misconceptions such as possessions by demons are still believed to be a cause of epilepsy among educated Saudis today. Shocking figures. This study was conducted among university-educated students, schools, and undergrads. So these are educated as educated you can get in a university. Responses from almost 400 participants were included in the analysis of the results. 40.3% of the school teachers and 50.4% of the students in the study considered possession as a cause of epilepsy. This is happening in 2012. Conclusion of the study: jinn possession is still believed to be a cause of epilepsy in Saudi society, even among fairly well-educated people. This finding emphasizes the urgent need for public education campaigns and whatnot, right? So, like we see that this is clearly showing us that if modern Saudis are so well-educated, or still 50% rates of misidentifying epilepsy and seizures, expecting Muhammad's contemporaries to use precise words or identify all his symptoms or be able to understand them properly is absurd, is unrealistic expectation from these guys. Now, what you also need to understand is they're talking about Sar'a as well in the top. And
you know, it's interesting that this is a symptom of Islam. This is an example how dogma is actually, modern humans are trying to progress, but this is like dragging them and holding them back to the point where even today in the 21st century, you still have widespread belief in jinns rather than trust in medicine, right?
Exactly. And so you'll see a prevalence of people going to faith healers, Pir Babas, shamans. In fact, I have people in my family who were, now this is funny, I have people in my family, not my immediate family, but amongst my relatives, that were inflicted with this disease. And they would instead frequent these shamans and these Pir Babas to get healed. But these guys are very, very educated. Like, some of them are nuclear physicists who are going and doing these things. And I'm not joking. I'm not going to name any names. So despite being educated, as the study suggests, people would misidentify things. Now we're going to watch in the next slide how Farid goes in his video and claims that the word Sar'a being used, or that she went to Prophet to get her own disease rectified, shows that Muhammad couldn't have had epilepsy, which is bizarre because it just shows that she wasn't educated or knowledgeable about the disease, and that people used to go to these shaman-like, pir-like characters or religious healers back in the day. There's nothing new about it. The argument then is also kind of similar to, well, if somebody didn't use the word epilepsy, the person won't be epileptic despite showing all the symptoms in a village in modern-day Saudi Arabia, per this argument sometimes. But anyways, let's play the video and then we will come back to more.
In any case, after the video, one of the brothers from Germany, mashallah alayhi, brother Muhammad, he contacted me, sent me the hadith, a very fascinating hadith that I came across before, but I never linked it to this topic. And subhanallah, he made me realize that this one hadith refutes all the information, all these arguments about the Prophet ﷺ having epilepsy.
The hadith, Ata narrated, Ibn Abbas said to me, "Shall I show you a woman of the people of paradise?" I said, "Yes." He said, "This black lady came to the Prophet, peace be upon him, and said, I get attacks of epilepsy and my body becomes uncovered. Please invoke Allah for me." I'm going to be ultra specific here, meaning I get seizures. The term epilepsy wasn't used at the time, even though it wouldn't really make a difference. But the correct sentence with the correct medical terminology would be, I get recurrent seizures.
This hadith can be found in Sahih al-Bukhari and Sahih Muslim. In any case, this report in itself is sufficient to demonstrate that Rasulullah ﷺ didn't have seizures and by extension epilepsy. And the reason is simple, because I mean, if he had seizures, then why would someone go to him and say, "Hey, please help me get rid of my seizures"? I mean, this is equivalent to like going to a homeless person for financial advice, or going to a mute for speech therapy. In the previous refutation, it was established there's not a single piece of evidence that Rasulullah ﷺ had epilepsy. However, with this hadith, we actually have implicit evidence that people actually came to him seeking his help, his support to get rid of their seizures. And with a heavy heart, a direct message to the ex-Muslim wannabe neurologist: please leave the neurology to the professionals. We don't have time to play doctor, ya Dr. Jalaluddin. And to the rest of you guys, Assalamu alaikum wa rahmatullahi wa barakatuh.
So, as we saw, that the argument, I mean, don't even need to debunk it. It's so absurd that if she had epilepsy, why would she go to somebody who might have had epilepsy? Because they just didn't know he had epilepsy because they were too ignorant. That's what was happening. Now, what
Yeah.
he won't tell you, and in the next slide, is you'll see his manipulation and lies. Keep in mind, jinns cause epilepsy. So the word would be majnoon. Next slide, you see a fatwa from Islam QA.
Yeah, even though you don't think it's worth responding to, I do want to say two more things. Which is, one, even if Muhammad had epilepsy and they knew he had epilepsy, they still believed he was a prophet. So they would still go to him and ask him to pray for them, because even if he had issues too,
Exactly.
well, first of all, they didn't consider the issues to be epilepsy; they considered it to be revelation. Two is, this woman herself obviously wanted help from someone, and this is her way of getting help. His analogy of asking a homeless person, like, homeless person can ask a homeless person for help. That there's nothing wrong with that. You know what I mean?
Another comment I'm just seeing, which is very good. Maybe because he was epileptic and the woman wanted advice on how to deal with it, considering he was direct experience. She's like, go to the best guy. But what Farid wouldn't tell you is the next slide, and he will hide this information from his fellow
In any case,
believers. To, like, look at this. In the title is called Epilepsy Caused by the Jinn. So the question is, since the epilepsy is caused by the jinn, how do we explain the black woman who came to the Prophet asking for him to invoke Allah for her illness and coming uncovered? There was no mention of jinn possession, or is there a mistake in the translation and it wasn't really epilepsy? Now, as you can see, the answer says epilepsy in most cases is caused by the jinn. The black woman's epilepsy may have been caused by the jinn. In fact, in the later part, you see the hadith about the black woman is narrated in Bukhari and Muslim. In some versions of the hadith, there is an indication that her epilepsy was caused by the jinn. For example, and he goes on, Zafar was suffering from, was the kind of epilepsy caused by the jinn and not that which was the result from dysfunction in the brain. So, a woman had epilepsy during the time of Muhammad. Her epilepsy is most likely caused by jinn possession. In some narrations, the word sarai is used. Given that most educated Saudis today believe jinns cause epilepsy, it is normal for people to have called Muhammad crazy when they saw him suffering during the revelatory episodes in 7th century Arabia. Was Muhammad alleged to be crazy or possessed by jinns like in epilepsy? What did the Meccans say and how did they react? Apostate Prophet's comment. That made me giggle. That's a good one.
I had a comment, but I forgot what it was now. I was gonna say, like, I feel like I need to call out the elephant in the room. Why is it important that she's a black woman? Like, her name is not important, but the color of her skin is mentioned. Why? It's so stupid.
It's just a weird detail, yeah.
It's like, okay. Anyways, okay. Continue.
So,
next slide.
Next slide, we see another interesting one is the Meccans actually did attempt to provide Muhammad with their best available, their idea of medical advice, right? So there was this guy, Dimad. He came to Mecca and he belonged to the tribes of Azd and Shams, and he used to protect the person who was under the influence of a charm. So he was like a witch or a wizard or some Harry Potter shaman guy, right? And he heard the foolish people of Mecca say Muhammad was under the spell. So he talked to Muhammad. The whole story goes, he converted to Islam or something because he obviously couldn't understand what's going on with Muhammad. And this can just be attributed to him being uneducated and obviously not being up to date with what epilepsy is in modern neurology, especially that given we had evidence from Egyptians, Persians, and Romans in the era around Muhammad were a little way more advanced, and we do find holes in skulls where they would try to treat the pressure, and they would think that drilling a hole in the skull would let out the evil spirit. Now, on the right side in Ibn Ishaq, this is even funnier. And so these guys were talking to Muhammad, trying to convince him to chill out, like, stop this whole drama. You're causing this unease and uprise in society. I don't want this. So they say, if you've learned sovereignty, we will make you king. And if this ghost which comes to you, which you see, is such that you cannot get rid of him, we will find a physician for you and exhaust our means in getting you cured. or often a familiar spirit gets possession of a man until he can be cured of it, or words to that effect. Basically, people of Mecca, Muhammad is possessed. Do you need a doctor? The point is that you will see these tidbits pop up again and again. Why were they saying these things? Right? Now, the next slide, we're going to go again to Farid and his cousin. We're going to listen to them again, being completely ignorant and just lying as if there's no tomorrow, like shameless lies. I can't hear the video.
Has been witnessed. Now, do we have any narration that the Prophet has been witnessed to have a seizure clearly by any of his companions or his enemies? We do not. I mean, they knew what seizures were. They might have not known what a focal seizure was, but they definitely know what is the difference between being normal and being in an abnormal state where you do not reply, or where you lose speech, or where you start doing weird abnormal movements. So
Okay.
the Prophet's
So
enemies did not witness him having any abnormal states that are indicative of a seizure.
I'd like to point out something in regards to the points that you've mentioned about the lack of documentation of a seizure to the audience. Non-Muslim audience members, and perhaps even some Muslims, would maybe assume that, hey, the Muslims themselves chose not to document this. Seizures occurred, but they didn't document this. I say that this is impossible, because the early Muslims, the Sahaba, the Tabi'een, the early historians documented everything. Remember, these are the same people that brought to you the satanic verses. These are the same people that brought to you information about Rasulullah ﷺ marrying Zainab. These are the same people that brought you information about Rasulullah ﷺ marrying Aisha. These are the same people that brought you every single argument that Islamophobes use and critics of Islam use against the Prophet, peace be upon him. So it's extremely, extremely unlikely that 100,000 companions would simply ignore seizures occurring. That's just from a historical point of view.
Keep the companions aside. What about the enemies? I mean, if he was an epileptic person, they would have used that as a very good propaganda against him.
Yes, you are correct. The Quran itself often quotes and preserves the arguments that are brought forth by non-Muslims. So they accused him of being a poet, or a sorcerer, or someone who is insane. However, they never accused him of having seizures.
Exactly.
So that's another point.
Oh
All right, so
I'm laughing. They're so wrong. It's funny.
Exactly. So they're saying that Muhammad's contemporaries like never saw anything weird with him. Like they never, but we just saw a reference that they were like sending doctors, faith healers to check up on the guy. And we will see now that in fact, it wasn't just a few verses. They used the word majnoon, demon possessed, the one that could be synonymously, as per Islamic scholars, used for epilepsy, about more than 10 times in the Quran, right? So these guys create this illusion where they lie, basically, to say that, oh, the contemporaries of Muhammad weren't saying anything weird about him. He straight up says they didn't say that they saw anything abnormal about them. But we'll see that they'll explicitly say that we saw the abnormalities due to the revelations, and hence we call them crazy. So they create this facade where they're now going to say there were no seizures, or there were no secondary generalizations. They're acting as if there are none, but we have literally sections, and we will show you how wrong and how much you lie. You're a pathological liar. Let's go to the next slide.
It really does feel like when he's listening, he knows that this is wrong, but he's just not saying it.
Now,
All right, so now we're at this slide. So these are all the Quranic verses that mention the word majnoon. I don't know if you can see them clear enough, but I'll read them out to you. 34:8, perfect. Has he invented about Allah or lie, or is there in him madness? Right? Bihi jinn, there's like a jinn in him. Is there a madness inflicted by him? That's what the verse. And we're going to go left to right, up and down. 44:14, they turn their backs on him, saying, he is tutored, he is possessed. The word here, majnoon, again, the same word for jinn, possession, as we talked about. 23:70, we see, why do they say he is possessed? Am yaquluna bihi jinn, again, he has a jinn in him or something. Has he brought them the truth and most of them hate it? And 68:2. Now, Surah 68 is actually the second surah that was revealed according to many hadith. Now, in the second surah alone, the second verse says, your Lord's grace does not make you prophet a madman. So from the get-go, people were noticing this about him. And again, the word used here is ma anta bi ni'mati rabbika bi majnoon, that you are majnoon, crazy, jinn afflicted. Some say muddled dreams, others say he made it up, yet others say he's just a poet. Let him show us a sign. So a lot of times they would use the kahin, crazy poet, as a synonym for mad people. In 15:6, we say, receiver of this Quran, you are definitely mad. Like they were straight up calling him, you are crazy. Innaka la majnoon, that you are jinn afflicted, you're crazy. They are not the words of a poet, how little you believe in. Continuation, this next verse says, nor the words of a soothsayer, how little you reflect. In 37:36, we see again, are we to forsake our gods for a mad poet? Lisha'irim majnoon, again, the same word. 68:51, the disbelievers almost strike you down with their looks when they hear the Quran. They say, he must be mad. لَيَقُولُونَ إِنَّهُ لَمَجْنُونَ, again. Say the Prophet, I advise you to do one thing only, stand before God in pairs or single and think there is no sign of madness in your companion. He is only for warning you before severe suffering arrives. مَا بِصَاحِبِكُم مِّن جِنٍّ. So he's again talking about him afflicted with insanity and jinns. And then lastly, in 52:29, on the top right, we see, so the Prophet remind people by the grace of your Lord that you are neither an oracle nor a madman. Bikahini wala majnoon. Again, Muhammad is being labeled as crazy. As explicit as the Meccans could have gotten in their descriptions, calling him crazy, the same word majnoon that Muslim scholars say can be used to refer to epilepsy. The black woman might have used that words as well. We come circling back to this. Now you tell me, was Farid or his cousin saying that they didn't notice anything wrong with him? Was he lying?
No, it's also interesting that imagine God keeps telling you, you're not crazy, you're not crazy.
A voice in the head tells you you're not crazy.
You're not crazy. Like that's the craziest thing ever.
Oh my God, right? So why are there so many verses dedicated to Muhammad's sanity? Why did the people call Muhammad crazy from the get-go? Did they see his condition as bizarre? Why was he called a soothsayer or a poet? Next slide, you will see another interesting bit. Remember Farid's cousin said that they never noticed anything abnormal about him? In one of those verses, if you look up Tafsir of Razi 7:184 and of Tafsir of 15:6, he straight up says the Prophet would be enveloped in a strange condition whilst receiving revelation. His face would change, become pale, and his condition would resemble swooning or fainting. And he's talking about why they would call him crazy. And he says, this is why, because they saw his condition. The people started seeing Muhammad having these seizure-like episodes. Due to lack of medical understanding, they could only assume jinn possession or madness as a possible cause. The conditions Muhammad experienced were definitely noticed as very bizarre by his contemporaries. Now that we've established that people did in fact see him in abnormal states and did call him crazy, and to a huge extent where it ended up being in the Quran so many times, you have to assume that this must have been something abnormal for the people to have noticed. Okay, now next section is where we start getting to the deep end of things. And this is going to keep getting worse for Farid and the Muslim side of things. We're going to get to the ringing bells. And Aura, we're going to take a patient video, a doctor explaining it, the Muslim corpus, what it says, Then we're going to look at Farid's video, and then we're going to show you that Muhammad indeed had secondary generalizations, and in fact it was most common, and he had so many tonic-clonic movements and stuff that it kind of becomes embarrassing to sustain the idea of his prophethood. All
At
right.
this point, he should have just been honest and said that we have reports of things that look like seizures that Muhammad was experiencing, that the Makkans thought he was crazy. I mean, it's undeniable. This is what he did was straight up dishonest.
Oh, it gets worse. It gets way worse. Anyways, we'll start off with Dr. Abbas explaining ringing bells. I'm going to mute my mic, and this is very
hearing
important.
the bell. I want to know about that.
That one is just like the seal of government. Any person who suffers from this condition would tell you that they hear the sound of the bell. And he said that he heard the sound of jaras.
Salsalat al-jaras. Right.
Yes. So that is, when I heard that, then I
To Dr. Abbas, the ringing bell aura is the stamp, the seal, the proof that he definitely had complex partial seizures. And that's what I'm trying to get to, is he's an expert. He's way more qualified. He's 40 years of experience, assistant professor and whatnot of medicine. And he says that this ringing bell symptom aura thingy is very, very significant. Now we'll go to the next slide and we'll look at the academic aspect of it, just to get an idea of what the literature says about it.
Okay,
So
before we do that, just gonna pause the stream for 1 second and remind everyone to thumbs up the video. Thank you, Chad Oliver. We do need the thumbs up. This helps YouTube to prioritize the video and share it with other people. So please do thumbs it up. And if you're listening to this after it's done, please do leave it a 5-star review on your favorite podcast platform. Thank you.
All right. So on the left side, we see autosomal dominant partial epilepsy with auditory features. And we're just going to look at symptoms such as buzzing, humming, or ringing. Some people experience more complex sounds during a seizure, such as specific voices or music, or changes in the volume of sounds. Bottom, we see in some people, seizure activity may spread from the lateral temporal lobe to affect other regions of the brain. If seizure activity spreads to affect the entire brain, it causes a loss of consciousness, muscle stiffening, and rhythmic jerking. Episodes that begin as partial seizures and spread throughout the brain are known as secondary generalized seizures. Now, what I'm trying to get to is when you have the aura of ringing bells, it is normally accompanied by secondary generalizations, which Farid's cousin will also allude to. But then they say that he didn't have any secondary generalization. But is that the truth? That is indeed not the truth. Now, on the right side, we go again just to we clarify the aura often start with buzzing and roaring sounds in the ears or the head, with loud music or human voices of a peculiar character. The epileptic patient often reports that a voice calls him names and reproaches him for bad behavior. The last bottom one, lateral temporal lobe seizures may have an initial focus seizures with auditory or vertiginous features. The focal sensory auditory seizure is usually a basic sound such as buzzing or ringing rather than formed speech. If the sound is heard only in one ear, it suggests the seizure is in contralateral hemisphere. With this aside, what we are going to do is we are going to move to the next slide soon.
Just a shout out that we have the brother Rashid who was in this video in the live stream.
He's a legend. I just want to thank him so much. I've used his videos. I want to give him. He did this 10 years ago, and if it wasn't for his work, I wouldn't have been able to do what I'm doing. Like I said, he brought to light Abbas Sadrian, Dr. Dede Kurkut, and you have to check out his videos. It's in Arabic, but it's all translated with the subtitles. Do check him out, Muhammad in the Light of Medical Science, parts 1 and 2, and he will be featured again and again. But thanks for the shout out, and I mean, amazing, legendary work from you. All right. Now we are seeing Muhammad hears ringing bells. He says something that we need to remember is what Farid excluded when he read the hadith was hardest upon me. Muhammad hears ringing bells. The angel sometimes comes to me with a voice which resembles the sound of a ringing bell. This is the hardest on me, like the ringing of a bell, and this is the hardest on me. And the same thing is repeated again and again. what we need to hit home here is the hardest on me. There's two parallel lines of descriptions of Muhammad's seizures you'll see. A is Muhammad's internal experience, i.e. what he feels. And then there's going to be a second description coming from the outsiders that are looking at Muhammad having the experience. So Muhammad is saying when he hears a ringing bell, this is the hardest seizure he experiences, right? Now, what is he trying to say is he ends up having a secondary generalization, which means that the seizure starts spreading from a focal onset all across his brain. It might start off as being sitting there and it slowly becomes into a full-on shaking tonic-clonic seizure. This doesn't happen all the time, but might happen more often than not. Now, we are going to go to the next slide where we will see a patient talk about her own ringing bell sounds.
I just wanted to talk a little more about the simple partial seizures I have. Just describing them a little more. It's hard for me to describe them because I find it hard, and I'm pretty good at clearly saying things, explaining what I'm thinking. So some of the other ones I would have, now I tend to have ones that are, I used to have auditory hallucinations. I still do. So oftentimes I feel a buzzing feeling. So I feel kind of like as if my head is vibrating. Not exactly, but if you've ever felt like your whole body kind of was vibrating all of a sudden, well, my head, it just feels more intense. So it's like suddenly I get a jolt of like, suddenly I feel this whole buzzing, vibrating feeling in my head. And like I said, I kind of feel it throughout my body, but it's mostly more intense in my head. Then oftentimes one side or both sides get completely muffled so that I can't hear. But then I hear this buzzing sound, or sometimes it's a ringing sound. So it'll sometimes be like I can hear the ringing through this ear and this one's totally muffled, or sometimes they're both muffled and I hear this loud buzzing sound. Sometimes you hear a shrieking noise. Sometimes I hear like they're actually not that strange, because this is not strange to me, because the other seizures are the ones that felt strange. These ones are a little bit more manageable. So these ones, I tend to have some kind of, like I said, auditory hallucination, and that's very typical of simple partial seizures and seizures.
So that was a very interesting patient video that described that she would have ringing bell sounds as an aura before her seizure. She would hear buzzing or ringing bell, and it was very common for her. And this is very interesting, especially going on in the next slide, where we see more patients having ringing bell sounds and hearing voices and similar things. Complex partial seizure derived from electronic malfunction in the temporal lobe of the brain, either inherited or acquired. Visual seizure phenomena can form visual hallucinations like a humanoid figure, example, the angel Gabriel. Examples of patients experiencing these kind of seizures are in the medical literature as follows. So Dr. Dede gives a bunch of patients. So patients saw a white-robed figure pass over his garden wall. As the figure reached the window, he lost his senses. Dr. Gover described a patient seeing an old woman in a brown dress offering him something smelled like camphor beans. Dr. Mudler describes a patient viewing 4 people in heaven doing some type of work and viewing 4 people on earth. Afterwards, he became drowsy and confused for a while. Doctors later mystical episodes which combine visual and auditory hallucinations. On the other page, Dr. Kennedy had a patient whose attack consisted of hearing a ringing bell, then seeing a woman clad in rags, and then smelling most evil odor. One thing important here is Muhammad would hear the ringing bell, and then sometimes a man would appear to him in the form of an angel, or the angel in the form of a man, sorry. During the time, I feel like I am in a trance. I'm about to leave my body, and sometimes I hear someone I know to me. Again, like Muhammad, sometimes you'll see a humanoid figure, sometimes you'll see or hear the voice of a person. This other person, one patient heard church bells as well as repeat experiences of depersonalization and many instances of criminal behavior. There's another case we had in our initial presentation that I haven't included here right now. Is this lady heard a voice and then she had a full-on verse recited to her that you're upright like the plant, go say something to the people, and it repeated a few times as well. But with that said, that we have now established that people hearing ringing bells and then seeing or hearing things is a normal seizure phenomenon. So to expect Muhammad to be seeing angels in reality and not similar to this doesn't make sense. This is what happened more likely.
You mentioned also, I don't know if you're gonna delve on this, but it mentions the bad smells as well.
So the bad smell is actually an old fact. These things happen with Muhammad as well. They're not explicit at times that Muhammad would banish people to the graveyard or say the angels hate olives, garlics and onions and stuff like that, which is bizarre. Why would angels hate anything? Angels don't have nostrils, right? So these smells, and then he would say, I love perfume, and he'd be known for applying so much perfume. So these are indirect references to him being sensitive to offensive smells. And then the whole issue with this slave, when he had sex with the slave, his wives were teasing him, the honey and the bad smell of the mouth thing, because he was offended by smells. This, again, is not a direct point, but it is very common where people with seizures can sometimes smell things as an aura as well. Now we're going to go to another Farid video, and this one's even, it's going to be another one where it's just tragically bad, with more lies, more drama, and more bad reading comprehension of hadith. Now remember what I focused on, the hardest upon me. I hear ringing bells, and it's the hardest upon me. Let's see how Farid looks at it. We're just waiting for the video to pull up. Let's give it a moment. The next slide. Right on.
Okay. The aura of ringing bells. How does the Wahi inspiration come to you? He said, it comes to me like the ringing of a bell, and is most severe for me when it is over I pain, or at times the angel in the form of a human being in whatever he speaks. We have discussed in papers before that ringing bell sounds are precursors to seizures is extremely common. In fact, we had a literal case with the exact same thing. Let's go to the next step.
I'd like to comment on that briefly, if you don't mind. If you can go back towards the previous image.
Okay.
So when speaking about the ringing of the bells, a bit forward, if you don't mind. Okay, so when he speaks about the ringing of the bells, he mentions something really interesting towards the end. He says that he says it comes in the form of the ringing of the bells, and also comes in the form of a man who speaks to him, right? So I find this really interesting because this implies that this is something that people saw. This shows that the Quran isn't from Rasulullah ﷺ himself, because there's someone who's actually teaching him the Quran. Now, it's not something that can be shrugged off as a hallucination. It can be shrugged off as some sort of symptom for some sort of neurological disease. It's a man who comes up to him, who teaches him the revelation. And it's a very, very eye-opening report, because it's something you just can't shrug off. But yeah, that's from a hadith perspective. Do you have any thoughts to share on this?
Okay, let's speak scientifically. Now, ringing bells are an aura of temporal lobe epilepsy, particularly in the lateral part of the temporal lobe, or the neocortical temporal lobe. This area, Farid, is in very close proximity to the motor area, or the motor strip, part of the frontal lobe that is responsible for moving the semi-half of our body. Seizures that originate in the lateral neocortical temporal lobe very commonly move on to, or they would secondarily generalize, meaning to say they would start with ringing bells or with hearing buzzing sounds, and then the patient would have a motor component involving the limbs. So in all of these, between brackets, seizures that Gondal describes, why isn't there any secondary generalization? That's the first thing.
All right. So something very, very important that I want to say about it. First thing you notice, again, like I said, they avoided completely talking about the part it was the hardest on me in relation to the narration. They completely avoided that. Then I don't know if he was trying to say that the people were seeing the angel come to him. That was obviously not the case. But I think what he was trying to say that seeing that a man was coming and teaching Muhammad somehow proves that he's not hallucinating. I don't know how that was an argument. Then, and at times, you will see later in on the presentation where we get to his memory aspect, where we show that Muhammad would just have seizures and he'd get no revelation or forget the revelation. But don't worry, those were the verses Allah wanted to cancel all along. These are mentioned in Sirat Halabiyah and the narrations are there. So one asks, and why is Allah just giving him seizures when he doesn't want to give him revelation? What the hell? That doesn't make any sense. And it only makes sense that he was just having seizures. One point we got to take away from this, that it don't talk about the hardest on me point. And then we're going to move to the next section. This is where that gets crazy. If you have any questions, we'll take them now.
Yeah, I was going to say, it's interesting. So he had acknowledges the ringing of the bell. Even his cousin acknowledged that this is an issue. This is a symptom. The other thing I found interesting was about that thing about a man was teaching him. That's bizarre because we know Khadija, like Muhammad would tell Khadija, Gabriel's here. Okay. And he gives his salams to you. Okay, give him salams back to him, you know? It's like he wasn't there, right? I mean, other than the hadith of Gabriel, where there is a narration of this man that's all white clothes, you know, came and sat down.
Funny, I found a Sahih hadith about that explicitly said that guy was Dihya al-Qalbi. It wasn't Gabriel again. Yeah, it's a hadith in the site. I think so.
Oh, okay.
I have it later in the presentation.
Okay.
So what we've showed now that they claim that Muhammad did not have secondary generalizations. They do admit that the ringing bells is a peculiar symptom, but when we go to the next slide and the next section, we're about to enter a part of the series which is unprecedented. This evidence, I believe, has never been shown before, ever on any platform. So this is going to be completely new. As we see here, they are talking about that same exact hadith. It was severe on me when he would hear the ringing bells. And there are scholars writing commentary on that. And let's see what they have to say. And Abu Abbas al-Qurtubi says, it was severe upon me. It was only severe upon him because he heard the voice of the angel, which was out of the ordinary, and perhaps he saw the angel in the form it was created, as he was conveyed about himself elsewhere. It was also severe upon him because he wanted to memorize it and understand it, despite being a continuously disturbing sound. And for that reason, his color would change, and his sweat would exude, and his state would affect him, similar to that one afflicted with fever. Fevers in the past, normally when mentioned with epilepsy, are associated with febrile seizures, as in when you have a very high fever, you are very likely to have seizures. And this would be a common theme that they will use the word feverish, trembling, and fever-like state to describe a convulsive state as well. And had it not been that God sent in them, he would not have been able to bear it. Why did Farid not mention or talk about the hardest upon me? Was because he knew this is going to happen. Now, next slide, we're going to just sidetrack a bit, and we're going to go to Dr. Matthew Woods, who's an epilepsy specialist. He's epileptologist, written multiple books about him. So in his book, we mentioned in part 1, we're going to now look at the excerpts and see what he has to say about Muhammad. So we're going to start from left and go towards the right. And let's start. So in consequence of repeated convulsions, he was returned in his 3rd year. And from then until his death, 57 years afterwards, he was a victim of the phenomena of epilepsy. The epileptic cry, hallucinations of sight and hearing, automatism, tonic and clonic spasms, and all of the prodromy and sequelae of convulsions would seem to have been distinctly manifest in his various seizures. But he had been but a few years married during an epileptic seizure that the angel Gabriel appeared and commanded him in the name of God to preach the truth as revealed to him. and to spread it abroad by committing it to writing. During his entire life, Muhammad's spasms were of unusual violence and length, fearfully rapturous and vehement. One thing you need to note here, that back in the day, they didn't have the concept of 24-hour clocks or timekeeping in the sense we have now. In modern neurology, there's a concept called status epilepticus, so you can look it up, where if a seizure goes on for 5 minutes or more, it's life-threatening, you were classified as epilepticus status. Farid's cousin brought it up that Muhammad didn't have status epilepticus, but in fact, in many of the narrations that we will see later on, show that Muhammad would be in this state for a while, and the wording would be he would be in this afflicted state for a while till he would return back later. So that time is not defined. So we can assume that he might have had status epilepticus as well. Okay, right on. He roared like a camel, which may have been but the epileptic cry, exaggerated and artificially prolonged by the extraneous psychic elements or by interested or devoted eyewitnesses, just as Chinamen with the best intentions, artificially prolonged or cues by horse and hair bits of string. Okay. Now, he also mentioned the word osiba, which is the Arabic word for an epileptic attack. On page 82, he says, Aisha said that while taken ill, he sometimes sobbed like a hysterical girl, and again that he cried out like a camel. About the hills near Mecca with suicidal intent, he heard a voice looking up, beheld Gabriel floating in space. He assured him that he, Muhammad, was the servant of God. Frightened by this apparition, he went home, and feeling unwell, he had a fit. And he was in the blanket shaking, covered, and then his wife was throwing water on his face. Sometimes they were ushered in by a coldness of the extremities and shivering. They were preceded often by depression of spirits and apprehension, and were accompanied in the premonitory stage by tinkling in the ears, airy bells were ringing, or bees were swarming around his head. His lips quivered, but this motion was under control of volition. Motion of his head convulsive and automatic. Sometimes, though, if the spell was violent, he fell comatose to the ground, went into convulsions. His face was flushed, respiration stertorous, and he remained thus for some time like this. Exactly the words that we saw. He remained like this for a time, but they don't specify the time because they didn't have clocks. At the bottom, he says, Muhammad himself fancied he might derive some benefit by being cupped on the head. We'll get to this, a whole section dedicated to his head trauma and headaches and migraines and his own remedies that he inflicted upon himself, causing himself more harm than good. All right. If you have any questions so far, we can take them, because now we are going into the section of the symptoms of Muhammad, which is going to be so explicit. It's going to be the most explicit you can imagine a 7th century man have and being described in history books. If, for example, Muhammad had epilepsy, the most explicit form you can imagine will be shown here. This is a long, long section. So if you have any questions, let's get to it.
Yeah. A couple of things, and there's a few comments and questions. So first thing I want to point out is Dr. Matthew Woods wrote this book called In Spite of Epilepsy, being a review of the lives of 3 great epileptics, Julius Caesar, Muhammad, Lord Byron, the founders, respectively, of an empire, a religion, and a school of poetry. Although I guess you could say Muhammad founded an empire as well. So this is an actual doctor that actually understood this topic and found references in Muhammad's life. So again, it's not us doing this, although we are pointing these things out, and it's other people noticing the same thing, right? Experts. Anything to add to that before I start taking the comments?
No, I think very good. We can take some more comments. Yeah.
Take a couple of questions. Okay, so I quickly glossed over 2 of them. I'm just going to go back. So Daisy Neo says it'd be great if you can do a session on his channel in Urdu for his audience who are mostly from Pakistan or India. Are you planning to do a session in Urdu?
Yes, so I plan on going on hopefully Haris's channel and some other people. We're going to do this whole series again in Urdu, of course, because this research is, of course, so important and of such a unprecedented, unique nature and has not been shown before to people that I think everybody deserves to know. Hence, I also plan on releasing this whole set of slides, about 400 at this point, so people can view them, share them, spread them around. And yeah, we'll definitely do this in Urdu. That was the plan from the get-go.
Awesome. Okay, next question was just want to say shout out to Derek of Myth Vision podcast. I love this stuff. Thank you guys for delving into this stuff. So all the credit is to you, Abdullah Gondal. The stage is yours. This is a friend of mine, Derek. He runs a nice channel as well, so you can check that out.
Thank you so much. Thank you.
And next comment, why the F would God make this so hard? Just imagine you can do anything, yet you make it so difficult for people to live. What a weirdo.
Exactly. Like, why is Allah making it seem so much more like epilepsy? Like, why make it so, like, it's like an enigma. It's like a game you got to decipher, read between the lines or something. Like,
and then, like as I mentioned, the Dr. Matthew Woods found examples in Julius Caesar and Lord Byron. So it's not limited to people that claim to be prophets. Other people went through the same thing that also did. Like Julius Caesar, like wow, like he did a lot. Okay,
there's a lot of we actually have a section where we have like a ton of contemporary famous people, historic famous people, and only the ones that are confirmed or diagnosed within their lifetime. And we'll go through them, and the whole idea that how did Muhammad create the Quran if he was an epileptic is absurd, because you'll have people creating equivalently or even way better literary works. And literally, schizophrenics are winning Nobel Prizes, dude. Like, there's epileptics who win Nobel Prizes. Like, what are you talking about? How can Muhammad not do it? This whole thing comes from this whole stigma around people afflicted by these diseases, that they're somehow these members of society that can't function, dysfunctional, laying on the ground, just trembling or seizing all the time. But that's not the case. Most of the time, people can live functional lives. I know many people, you've known many people like that. And yeah, Muhammad certainly was one case that was very similar to that.
For some of the most, Doorknob Head drops a 50 saying, for some of the most fascinating and well-researched content I've seen in a long time. Really enjoying it. Thank you. Thank you, Doorknob Head.
Thank you so much. If you guys are loving it so far, it's about to go up a notch, like exponentially. It's gonna get crazy now.
A couple more comments and we'll get back to it. Chat Oliver, $10. Abdullah Simon, I suggest you do a variant of these epileptic prophet episodes in the language such as Arabic, Urdu, Hindu, Chinese, etc. with ex-Muslims together with subtitles. Yes, I believe Brother Rashid has done something in Arabic. So this is the first time now we're expanding on his work, refreshing what he's done from a few years ago, adding on to it and extending it. So yeah, it'd be great to get this on to the next level. Okay, and the last one, then we got to get back. Salute to Abdullah Gondal. Thanks for the £2, Storm Pilot. I was going to say one more thing. But Smarks likes Killed Wrestling. We're going to talk about this. We're going to talk about this, we're going to have examples of this, so we'll get to that. Thank you. All right. Anyone, last one. Has anyone with a gin won a Nobel Prize?
Actually, yes. So who was that? John Nash, the guy who invented game theory and got the Nobel Prize for it, was diagnosed as schizophrenic, had Messiah delusions and whatnot. His schizophrenia receded later on, but because of that, he was in mental institutes and he ended up winning the Nobel Prize in mathematics, out of all things. There's a movie about him, The Beautiful Mind. So I would be steering very clear of trying to project these ideas. Oh, because he's crazy, he can't do anything great. In fact, you'll notice by the end of this presentation, most of the time it is the crazies that push humanity forward, because you need sometimes crazy people to poke you in the right direction. In fact, sometimes being different or so different from people makes your viewpoint stand out that it's just, it sticks, We'll get to how Islam spread from a political point of view later on, but let's keep going. We're just getting started into the juicy bits now. So first off, we'll have Dr. Abbas explain a little bit of what seizures are.
Alrighty. And anyone that's watching this after the stream is over, you can also donate. I'll put a link in the description for how to donate and support Abdullah Gondal for all of his hard work. So the link will be below. And I will play this clip now. Give me 1 second.
If you have one side of the brain causing the other side moving, you're going to have the grimace and shaking. And if it is the part complex, then it is going that you are going to feel life is coming out of you. Left temporal lobe, seizures, senses, hearing voices, smell, and taste. We call them olfactory hallucinations, which is the nose. And also, this condition in old times was called the illness of bad taste. So, in order for a person who lived 1,500 years ago to diagnose it, they would say that they taste, have bitter taste in their mouths.
Does it give also a bad smell?
And bad smell. And the way that they used to overcome it was, and it still is for the patient to use perfume, cologne, and also sweets.
So he can get rid of the bad smell and get rid of the bad taste.
And his favorite food was halwa.
Oh, Muhammad.
Wow.
His favorite food was
halwa and asal.
Asal. Honey.
Okay. All right. Now, every one of these that I get, I'm seeing,
more.
Yes. I'm getting closer. It looks like that this is beginning to make sense.
Do you comment here by the reminiscence? Also note that Muhammad's diagnosis is temporal lobe epilepsy with simple and complex partial seizures, not general epilepsy with major seizures, right?
Yeah, so he had temporal epilepsy with focal onset with secondary generalization. So he was complex partial, but they would generalize sometimes. So yeah, and I mean, this thing, as it confuses the audience a little bit. You will get to the diagnostic bits of each book that we reference, and we'll let the doctors state it out by themselves. And we'll have Ali Rizvi to explain all of these things in a little bit as well. Right on. So the next, this is where it's going to get very interesting. On the left, you see is Lane's Lexicon, a very, very popular dictionary for classical Arabic. The word you're seeing is buraha. If my pronunciation is correct, it means severity, violence, or sharpness, or vehement molestation of a fever, a paroxysm used in this sense by modern physicians, and vehement distress of mind arising from the oppression caused by inspiration or resolution, such as is said to have affected the Prophet, but most probably paroxysm of a species that of catalepsy, which physicians term ecstasy, occurring in traditions. You may say one suffering from fever when it is intense. The paroxysm or severe fit has befallen him. Ironically, this is the word that will occur again and again. And the dictionary uses Muhammad's name or Muhammad as an example, which is very funny. And then they're describing it's a paroxysm. It's a fit. It's an insane, distressing thing. And if you look what paroxysm is, and I think it's Merriam-Webster, it says, definition of paroxysm, a fit, attack, or sudden increase of recurring symptoms of a disease, convulsion. Convulsion, the paroxysm of an epileptic seizure, right? Now we see this. Now, the next slide, we're going to be looking at, now this is a disclaimer I want to put out. We do not need to be making fun of the patients. We do not need to laugh at them or say bad things about them. We're showing these videos for educational purposes and educational purposes alone. We are also accessing these videos from the public domain, so it has been made sure that these patients were okay with their videos being displayed. And I want to remind you that please respect the patients that appear in this thing with what they talk about their disease. And yeah, with that said, we will show you what a seizure looks like. Listen to the sounds, the snorting camel sounds. Listen to the frothing, the foaming, rolling of the eyes. Pay attention to the details. We'll come back, circle back to this in a little bit. What you're about to see here, and I'm going to tell you right now, I will show you the most explicit evidence of Muhammad having exactly this. Let's see.
Sweetie. Let's do this too. Okay, I can grab a pillow for you. It's okay.
you can pause the video now. The point that I was trying to show you was that during the seizure, it is very hard to watch, and you will feel bad for Muhammad too and these patients. And I apologize for that, but we have to understand to get the gravity of what Muhammad went through. Just from a humanistic perspective, it makes us empathize with them more. But here you notice that you see that the convulsions, but then you also see there's the stiffening, the tonic stiffening happening, but then the breathing problems. You can see that a person is having a hard time breathing and they're making deep snorting sounds. This happens, and if you want to watch the exactly, if you want to keep going, we can keep playing the same video for a little bit more, maybe lower the volume, and yeah, see the camel sound. The sound kind of went away this time. You can pause the video now, and we can watch the second one just to get a quick and the difference.
দেখি মা দেখি দেখি এটা তুমি দাও সেদিন দাও ডর্মিকা মানো না কাজ করুন কিছু করতে যাবেন কিছু করতে যাবেন এই যে এই সময়গুলো কিচ্ছু মুখে দিবেন না কোনো চামচ দিবেন না ওগুলা দিলে ওর সুবিধার থেকে অসুবিধা একটা
Listen for the sound.
Ari the phosphine tripano. কিন্তু এই সময় ওকে ধরবেনই না
We can pause the video now, and as we can see that the patient experienced those snorting camel-like sounds on the other side as well, and then they're also salivating. Muhammad foamed and frothed, and it went exactly through something like this. Now, what we want to show next up is we're going to keep this in mind. Remember these two videos when we go through this whole section. So I'm just going to give you a preview of what we are. The convulsion section for Muhammad's convulsions will run from slide 93 all the way to 130. You're going to see references upon references of Muhammad explicitly trembling and convulsing. With that aside, we're going to go to the next slide. We're going to remind ourselves how Farid's cousin said that where are the secondary generalizations? You'll find out these guys are blatant liars.
What are secondary generalizations?
So secondary generalizations are seizures, basically like tonic-clonic seizure will start with an aura, a focal event, but after the point of start, the seizure then starts spreading all over the brain. So then it spreads into a tonic-clonic or a stiffened tonic or like a generalized seizure spreading throughout the brain. That is a secondary generalization because it became as a localizing point and then spread after. Where opposed to like a generalized onset, whereas it starts off as a generalized seizure.
Mr. Gondal says that the Prophet had temporal lobe epilepsy. And in temporal lobe epilepsy, yes, you can have focal to bilateral tonic-clonic seizures, so focal evolving to generalized seizures. But where are these seizures? Where are they? You said that the Prophet had postictal psychosis. Where is the ictal seizure? Where is it?
All right, guys, this is it. This is when we start to make him cry. Right on. So seized by severe trembling. Next slide. These guys are saying, where are the secondary generalizations? These guys act as if this evidence doesn't exist. They strawman the shit out of you. That's what Farid does. Farid the fraud, Farid the leaker. I mean, whatever. He's known to do this so much. It's annoying. It's frustrating. But I gave it to this time. I was like, you know what? I'm gonna go deep, get the evidence. So there's no doubt left in people's mind. Right on. Let's go. Let's start. Let's kill this myth of Muhammad. So first off, we have a narration here, Sahih. It says there too. It says Zayd bin Thabit narrated that I used to write down the revelation of the Prophet. When the revelation descended upon him, he would be seized by severe trembling and convulsions and severe sweating like pearls. Right on. So this is explicitly saying the word Barha is, I think, mentioned as well. Now, this is one narration. Let's go to the next book. We go to the next slide. We have Khasais al-Kubra by As-Suyuti himself. Now, funnily enough, I am not doing these translations. This is another scholar, and this is an Urdu book. Just to show you, I'll bring the Urdu versions too, to show you that the scholars are doing their translations. Here it says in the bottom left, Zaid bin Sabit se riwayat hai, इन्होंने फरमाया कि नबी करीम की वही लिखा करता था, जब आप पर वही नाजिल होती तो आपको शदीद लर्जा लाहिक हो जाता और आबदार मोती की मानंद पसीना नमूदार होता. Now this hadith is also an extension of the hadith where the guy was sitting with his leg under Muhammad's leg and he thought he was gonna get it crushed. He wasn't getting it crushed from the burden of revelation. This hadith is sahih and it shows you that he was seized by severe trembling. That is what caused that sensation. So imagine this, if you have a tonic, remember that stiff lady, their legs went stiff? Your leg is underneath and somebody's legs go stiff, you're pushing down on them. It's going to create a sensation of weight. That's what was happening. There was no weight. In fact, Muhammad was just seizing. That kills that narration as well. Let's go to the next slide.
It doesn't say it in English, but basically the hadith says that there was a big weight pressed on the companion, and he felt his leg was going to break even, right?
Yeah, you can pull the, if you want the actual full version, that smaller version in Sahih Muslim that occurs, that Muslim like to use, but they aren't aware of the full Sahih version, or what was causing. He was actually having a full-on convulsive fit causing that sensation, but now we know. Now let's go to the next slide. We have Burhan al-Quran, Fits of Revelation. This one says that the hadith of Muslim conveys the state the Prophet endured during the coming down of revelation, and it is called the intense distress, pangs of revelation. The word was the one we looked at in the dictionary earlier, Buraha al-Wahi. It's the paroxysm again. He's having a fit. These are convulsive states Muhammad's having. Let's go to the next slide. This is Itqan. The next one will be Itqan fil Ulum al-Quran by Suyuti. It's a very famous book. It has been narrated in some narrations that he fainted and that is conveyed during the state when he experienced the coming down of revelation. It is called the intense distress, pangs of revelation, paroxysm. Same word occurs again that we discussed earlier. Let's go to the next one. Guys, it keeps getting better. This one has the whole chain right there showing you that it is sahih, it is reliable. Mu'ajma al-Awsat, Tabrani's book, it says, Zayd bin Sabit narrated that I used to write down the revelation of the Prophet. When descended upon him, he would be seized by severe trembling convulsions and severe sweating like pearls. If you want to keep reading, this actually goes on to show you the other part where his leg was in there and all that. And I felt like couldn't walk again after ever.
So now, Zayd bin Thabit is saying when the revelation came, he would be seized by severe trembling and convulsions. He's literally describing a seizure. How much stronger evidence do you need than this?
That's what I'm trying to tell you. The evidence is so explicit. It's the most explicit you can possibly imagine from the 7th century. That is the one you're going to get today. And the words in Arabic being used are akhastuhu burahan shadida. Like he's seized by this buraha state, whatever. Shadid, severely. Like they're using the most severe forms they could describe because they even are out of words. Because remember, these are 7th century Arab people. They're not clinicians to be using medical terminologies. They have to make do with what their vocabulary has, at that time. Next book, we have another one. Nubuwwat Muhammad fi al-Quran, feverish trembling. Zayd bin Sabit narrated they used to write on Revelation, seized by severe trembling convulsions. And in the bracket, this author writes the word hama, which means fever. So he adds that feverish trembling to it. Now we get another one here. If we move to slide 104, we have feverish trembling once again. Zayd bin Sabit narrated that I used to write down and he was seized by severe trembling and convulsions. And here the word again is burahan shadida. And in the footnotes, if you see burah al-hama, so he's talking about the buraha, the convulsions of the hama, which will be the fever. So feverish trembling again. Now we go to the next slide again, is slide number 105. This is a Bihar al-Anwar by Imam Majlisi. This is a Shia narration. So we got to switch sometimes back and forth to show you that both corpuses kind of narrate these things. There he says the word buraha al-wahi, buraha al-wahi. Pardon me if my pronunciation is not entirely correct. The intense distress pangs of revelation, paroxysm, meaning his face would turn ashen, and he said al-barah means intensity, and from it comes the hadith, intense paroxysm, baraha seized him, meaning anguish due to the weight of revelation. Now, at the bottom half, Tafsir Ayashi says from this guy that he said the prophets taught that the devils had appeared to them in the form of angels. This is an interesting point where not only prior prophets taught that, in fact, Muhammad had a satanic verses incident. And in fact, the Quran itself affirms in, I believe, Surah Hajj, verse 52, that the Satan used to inject words into the revelations of Allah. This brings us back to, okay, these guys cannot even decipher their own visions and stuff. How do we know if they're seeing the Satan or God? And in what reliable form can they transmit the message? At this point, it becomes clear, okay, these guys are not really the ones God's going to be talking to. This is just probably neither God nor Satan. Is just straight up mental disorder. Now, with I want to read some comments. I want to see how it's going so far.
Yeah, alrighty. Give me a second. Friendly ex-Muslim, accept Islam. May Allah guide you. Ameen. And I responded, Allah did guide me to kufr. So alhamdulillah, you know. Gondal is a great TV presenter. He could sell jinsu knives on TV. That's not all you get. Just wait. It gets better. Brother Rashid quoted the hadith. So Allah sent down revelations to his apostle while his thigh was on mine, and it became so heavy for me that I feared my thigh would be broken.
Exactly. That was the full hadith, and this the additional version that we see here.
Hulkster says, for Farid, this isn't getting better.
Oh, it gets worse, bro. It gets so much worse, man. It's like there's points where they'll be speaking in the video, and I'm like, yikes, man. I at the same time, I want to say something like Farid's cousin. We have to respect him that he is a neurologist, he is an epileptologist, and I do look up to him for that matter. But I think what happened here is Farid exploited his cousin's ignorance about apologetics in the field and the depth of the argument just to get views or clicks for himself. And that is what I feel honestly happened. He put his cousin in the spotlight without informing him of what actually lies behind the curtain.
And I'm pretty sure he's the one that his cousin is trusting him that he will point out the hadith, because his cousin probably doesn't know
exactly.
The hadith, you know what I'm saying? Like you feel like even when you're watching it, you feel like he wants to say something, but he's not going to. You know, when his cousin asks him something. This comment was great too. When you thought being close to God will bring you happiness and peace, yet the guy is suffering like he's close to Satan. Right? That's what the Quran says. Like a man afflicted by Satan, those will consume riba, right? There was a really good question. Oh, I found it. Joseph Duff Kalisics, I apologize for not pronouncing the name. Thank you for the super chat. Considering that alcohol is important to ritual in both Judaism and Christianity, do you think that Islam's exceptional prohibition on alcohol has its roots in Muhammad's possible epilepsy? And I want to point out that even to me, when I found out that Judaism has kosher alcohol and Christians, at least Catholics, they drink, wine in church, I was surprised that like Islam, there's a disconnect there, right? So either they corrupted it, or more likely from a obviously looking from a secular perspective, Muhammad took it to a further extent. What do you think about this?
This is fascinating because we know that alcohol can cause or trigger epileptic seizures, right? So in fact, remember the guy that was interviewed by Dr. VVS Ramachandran in part 1? If you watch the video, his epilepsy, one of his seizures was triggered by alcohol consumption. So a reason that Muhammad might not have liked alcohol and vehemently banned it after a while was because he might have been exacerbating his seizures or his psychotic episodes. This, again, is very speculative. We cannot know for sure, but it is an interesting theory.
All right. Last few comments. So going back to the video, imagine looking at that in the 7th century. Surely it's jinn or Allah. So that it's true. Like it's disturbing and it's scary being able to see that, right? And one more comment. Wow, being close to God sure sucks. Because the prophets are like the ones who are going through all this, right?
Okay. Yeah.
One last one. This proved that it is true that Muhammad was sincere and believed he was a prophet and not lying. So I think that's part of it. I wouldn't agree fully because there are situations where he felt like it feels like he's making up stuff to benefit his own needs. And there's quite a few examples of that. But this is not the point for this episode. So
yeah. All right. Now
guess what we have?
We have a special guest here with us to join us now.
And
I'm so excited.
Hello.
Hey, I just got a revelation from Allah. Like I was seizing in the other room. That's why I'm late, everybody. And he doesn't like you guys. He doesn't. He's not happy. You're onto him.
He likes us. He does. Both of their names are Abdullah. What more love can you get than that? And your name is Ali. So
I know. Yeah.
He's the other caliph. You got a tubaya on his head.
So you guys arrive at a diagnosis yet? Well, we know. So.
We're going through right now through his epilepsy symptoms. In fact, we're going through his trembling and his convulsive generalizations right now.
Yeah.
And we are through quite a bit. We have so much more. Like I found like 50 or so references almost for his convulsions. We have about 30 or so for his faintings, and there's a lot of Shia books too. So I'm excited to have you here because you have the aspect from the Shia side. And obviously, I'll let you introduce yourself, your medical background, your qualifications.
Yeah. My name is Ali Rizvi, everybody. I am what is there? Yeah, I'm the author of a book called The Atheist Muslim: A Journey from Religion to Reason. I'm also co-host of the Secular Jihadist podcast, and I have my own podcast called Professional Novice. I'm a huge fan of both of these Abdullahs, and I love the work that they're doing. I love the fact that they're both from this, you guys were both like really, really super religious at one point. So you're one, and then you came through here. Now I think the background that's relevant that you're hinting towards is that I am a physician. I specialize in pathology, which is a specialty that deals with diagnosis. And we did a lot of, there was a lot of neurology involved in it, even though that's not what I specialize. I specialize in cancer eventually. But I have worked a lot with, I'm in medical communications right now. So I've worked a lot with epilepsy and at least, companies that are working on epilepsy, like pharma companies that are working on epilepsy. So a lot of the sort of the new information. The one thing I want to say, like GONDAL, yeah, okay, is that the thing with seizures, like generalized seizures, partial seizures, and all that, is that you do have a whole range of symptoms. You can activate, the autonomic nervous system. I think you talked about that before. You probably have. I missed the earlier part of the broadcast. But so autonomic, there can be sympathetic symptoms. There can be parasympathetic, both those aspects of the nervous system. The sympathetic is a fight or flight. When you're in an elevated state, the parasympathetic kind of slows you down a little bit. And both of these can occur. Right. So a lot of the symptoms that you're going to find, you will find descriptions of these somewhere in the literature. I think one of the ones you told me about, Abdullah, was grunting and snorting, or snorting and grunting. So that actually is something that can happen in generalized seizures. So that is something that's documented as grunting, snorting, drooling, frothing at the mouth. Drooling and frothing at the mouth is pretty typical. Grunting and snorting can happen. Teeth grinding can happen. You can fall, you can lose consciousness, you can lose control of your bladder or your bowels. There's many different symptoms. There's a wide variety of them. So chances are, if there are any symptoms, you will probably find them in the literature.
Mm-hmm. So going off on that, you mentioned that you work with epilepsy and mental health and diagnostics. So did you ever in your personal rounds or life come across similar patients that would exhibit, let's say, the Messiah complex or something like that?
Yeah, well, I didn't actually work in neurology and epilepsy as a specialty, but I have worked with pharma companies who do work on epilepsy and do medications for epilepsy. can't talk about too much about what exactly I do. But when I was in medical school, and this is going to be fun for you because I was in Pakistan in medical school, and I did my psychiatry roses. I did about a year of psychiatry, when I was there, because that was one of the things I was potentially interested in going into. And during that time, I did electives, and there were people. It was a very, very common delusion of grandeur to see, especially with the people they used to call them manic depressive. Now they call them bipolar type 1, where they used to think that they were messiahs, right? So what I saw comedy like firsthand for me was the Mahdi. So there's a lot of people would say we're the Mahdi, and then they would say then there would be a couple like they would share them. So I remember one specific where there was a guy who was very influential, very charismatic, as people in their manic phase can be, right, in bipolar 1. And he said that he was a Mahdi, and around him several other patients were very convinced that he was, and one of them said that he was his Sipe Salar. Do you know what that means, Abdullah?
Kind of like his assistant or like a sidekick?
Like a chief of army staff, I think. Like it comes from Sipahi, like Sipe Salar. So he was like his lead commander. So they would sit there and they would, come up with these. It was actually quite, it is a very common delusion of grandeur with bipolar patients in places like Pakistan. I'm pretty sure in other Muslim majority countries as well. But the disclaimer here is I've got very limited experience when it comes to actually seeing patients. I don't see patients anymore. I mean, I did pathology, so the only time I see patients is after they've died, which is very relevant to what you're doing. But
I'm just reading the comment here. In Iran, we have 2 Mahdis per week.
Yeah. There's a lot of Mahdis. Mahdis are everywhere.
It's funny because in Islam, there's no more prophets. So now you get Mahdis.
Well, you can't do the prophet. Imagine, like you can't, like even in their states of delusion, in especially in Pakistan, nobody's gonna say they're like a prophet, a subsequent prophet after. I mean, we know what happens to people like that there, right?
Yeah, like Rashid Khalifa he said he was a prophet and he was executed, right? The number 19 guy.
Well, yeah, I mean, look at what that happens to the Ahmadi Muslims there, right?
Recently, the guy that was a U.S. citizen got shot in Peshawar. It was actually, I think he was schizophrenic or something and claimed prophethood, and that's why they shot him. Something like to that extent. But going on with that, you mentioned that you deal with the people after their death. Diagnostics, can we do posthumous diagnosis, and what is the extent this has been done in medical history or field?
It's really hard. It's a tricky area, like posthumous diagnosis of, especially when you have something like epilepsy. And I'm just going to sort of tell you, I know, what you guys are going on here, but like to be completely with complete candor, what posthumous diagnosis for something like epilepsy, for instance, can be tricky because pretty much most of the symptoms that you can think of, you will find in the literature, right? You have your autonomic nervous system that controls everything, cardiovascular, breathing, all of your involuntary, your gut. Well, I mean, your gut's controlled by the enteric component of the autonomic nervous system. So there's, so all of these can cause different symptoms, and some of them can actually be opposite, like pupil dilation, for instance. Pupil dilation, which is called mydriasis, and then the contraction of the pupil, which is called meiosis, like M-I-O-S-I-S, not the division 1, cell division 1. But these are like both of them can happen, in different patients. Sometimes they can happen in the same patient. You can have the sympathetic and the parasympathetic systems going together. So in those cases, when you look at it posthumously, I think you could probably pinpoint that, okay, the person has epilepsy. I don't think you can go further than that. You can say there are symptoms of epilepsy. I mean, he had these incidents where he's going, there are all of these symptoms happening. Some of them seem to be sympathetic symptoms, some seem to be parasympathetic. And all of those descriptions are in the literature. So you can tell that there is a seizure. You can diagnose that kind of, right? I mean, nothing with 100% certainty. But I don't think you can really go further than that and say, well, is this temporal lobe epilepsy, for example, is associated with, people who think that they're prophets and think that they're messiahs and everything. But you can't, I don't think you can diagnose that posthumously. There are incidents in history, for instance, with stuff that's more organic, there's a condition of, you get these swelling nodules in your armpits and other areas in the body. It's called hidradenitis suppurativa. It's a complicated name. Karl Marx wrote a lot about his symptoms. Like, I had these boils come back. They're very, very painful. He used to write about it quite a bit. And he was actually diagnosed later with, like, many years after his death. Again, not 100%, but it was pretty classic. The way that he wrote about it was pretty classic presentation of hidradenitis suppurativa. So yeah, you can, to some extent. How with epilepsy, it's a little difficult to get that specific, because seizures are something that are patient reported. And, while you're having a seizure, you can do an electroencephalogram or an EEG, and you can kind of figure out that someone's seizing, or you can see it by their symptoms. But if they're at home and they're seizing, the only thing that you as a physician would have to go by is them coming in and reporting it. Okay, I had 2 seizures this month. You just you have to trust them. So, the medical history is extremely important, when it comes to this. Your symptoms, people who are around you, family members, friends who saw you, who can describe your symptoms. So those kinds of things are extremely important for at least physicians to be able to really pinpoint what's going on, because it doesn't leave any sign afterwards, right? I mean, once you've had the seizure, you're not gonna, it's electrical activity. So once that electrical activity is gone, everything seems normal, right? So you can go a week after the seizure and get your seizure from a week before diagnosed through some test. I mean, that's not going to happen.
I was going to say, it's interesting that one of the questions we got asked during the stream was, did this happen to other prophets? And we've actually had other people ask us, why don't you do this sort of presentation on other prophets? But it's one of the miracles of Islam that we have so much detail about Muhammad's life, to the extent of like really particular details that they just don't seem to be made up. Like, why would someone make up the fact that, the prophet was seized by severe trembling and convulsions? So stuff like that, it makes it seem, quite convincing that if it wasn't this, then what else could it be? Right? Either he was, spoken to by an angel that made him shake and tremble and foam from the mouth and snort like a camel. And so do we want to go through some of this stuff, Abdullah Gondal, with Ali, so he could see it? Because I don't think he had a chance to look at it.
I mean, I've seen a lot of your stuff before. I don't want you guys to repeat something if there's a live stream and people have already seen it, because that'll be kind of, but yeah, if there's anything relevant you want to go through specifics, we can kind of look at it.
So I had a few questions. So we're talking about the precise, like you could kind of point towards a neurological disorder at play, maybe epilepsy being the most likely diagnosis. But like you said, we can't go further than that, because you'll need, like I said, MRIs, EEGs, and all sorts of testing to determine where the localization is happening, or
if there is. I mean,
exactly.
you can't really, I don't think you can really go in and say, okay, well, he had myoclonic seizures, or he had tonic-clonic seizures, or it was partial, or so you can't, I don't think you can really subcategorize it with confidence. You can find little clues here and there, but I mean, for example, the snorting like a camel, which is my favorite symptoms, by the way. You guys talk about that a lot, but I love the fact that that's in the hadith. But anyway, snorting, so that's something that is mostly associated with a generalized, generalized seizure. But then, can it happen if someone's having a part? You don't know.
Exactly.
So it's a difficult thing to really subclassify with confidence. But if you have trembling and convulsions, I mean, it's and all of the other symptoms together, that he's having a seizure. Like that's something you can say with quite a lot of confidence, even if it's not 100%.
Another thing you mentioned is a variability in symptoms, right? So for example, somebody might be experiencing at times just the absence seizures and not fully losing consciousness, but then other times he's having a secondary generalization where he actually is fully knocked out and is snorting and trembling. And sometimes it's just a complex partial where he kind of like has like a grimace, or his head kind of turns and he kind of looks around, moves his lips a little bit, and then it stops, right? So that's one thing that I wanted to touch on too, where it could be very variable from event to event, even within a patient's life. So to determine exactly which type of event was which seizure with detail is impossible. But
Yeah,
something you mentioned about the family descriptions and stuff, right? So I did notice like a lot of Muhammad's family members didn't accept his message, which is very interesting. Like his uncles kept saying that no, we don't believe him. One of his sisters died not believing in him. So it's quite interesting, and seeing that like the things he went through in his childhood, the traumatic childhood. Do you think that trauma on its own would have added to Muhammad having such things later on in life, like losing his parents at like
yeah.
This
is a tricky thing to get into again, because there's a lot of there's a lot of young people, kids who have epilepsy, who have absolutely wonderful, super supportive parents, and they don't traumatize. So if we say that, yes, a lot of times when you say that, okay, childhood trauma or sexual emotional abuse may be associated with epilepsy, higher incidence of epilepsy, prevalence of epilepsy, then it can be it can be hurtful to a lot of parents. Like, oh, are you saying that I abused my kid? But that's not the case. Like in the vast majority of cases, that's not the case. But yes, there is an association. And I've seen this in a couple of places that generally with it's not just epilepsy. Well, I mean, with in kids who have epilepsy, if sexual and emotional abuse from childhood, they're more likely to have that. Let's put it that way. Okay. So they're more likely to, because I want to make sure I get my words right. It's not that, if you've been abused, then you're more likely to have epilepsy. It's that if you have epilepsy, then you have a slightly higher chance of just the fact that, you may have been gone through abuse or had some sort of like adverse experiences in childhood. So, yeah, so I mean that is something that's documented in the literature. I think you have a reference for that too, right? And you have a couple of references for it.
Yeah.
So
I was thinking like what we can do now is to look at some slides and then keep going, and we'll take Ali's commentary on it. There's a lot of Shia references as well. So I was we were just on this one, Biharul Anwar from Imam Majlisi, and he was talking about that other prophets taught that the devils had appeared to them in the form of angels. So I was thinking like, well, it's weird that these people can't even decide for themselves who's visiting them. How are we able to trust them telling us, passing on God's revelation, right?
Yeah.
But another word that keeps occurring is this al-buraha, and it says that he was kind of seized by this intense trembling and anguish, or pangs of revelation, right?
Yeah.
Let's go to the next slide and see where we're at. So here we are, Sirah ibn Kathir, which is feverish trembling. And this was written, I think, like 14th, 15th century. And he's talking about Muhammad. So he says that the Prophet of God said, fearful and shaking, and he read the document. Part 2 of the highlight, he would be gripped by a feverish condition and have a high temperature. That is, he would breathe hard and sweat profusely. Others say that Gabriel acted in ways for various reasons. When revelation came to him, his face would turn red and he would breathe heavily and fast like a young camel, while his forehead would stream with perspiration on an extremely cold day.
So just going by that, well, I keep on saying Abdullah.
Just call me Samir and call him Gondal. It'll be easy. Yeah.
Samir and Gondal. Okay, so like going by that, I mean, what this sounds like. Let's see. What did you say? You said heartbeat, fast heartbeat, fast breathing, sweating profusely. So these are some things that, for example, could happen. They could certainly happen with an epileptic seizure, but they could also happen with panic attacks.
Mm-hmm.
Right? So people have, when they have anxiety disorder, they can have panic attacks. So they can happen with, if you're having a panic attack, a lot of times it feels like you're going to die, right? So you have this extreme, you get tachycardia, you get what they call tachypnea, is really, really fast breathing. Like your gut motility, your bowels start moving like crazy. So there are several things. You have this sort of adrenaline fight or flight type response with panic disorder, and it can be painful. People can feel pain. They feel like they're having a heart attack a lot of times. So they get very anxious. So a lot of these things, the sweating and everything, this could be pretty consistent with a panic attack. Like there isn't anything here that is specific to a seizure. But then again, if you do have epilepsy, a lot of times, you have incidences of the other psychiatric disorders. You can have those, concurrently. So
a comorbidity of anxiety coming up with an aura or during seizures, right?
Yeah, possibly. But I mean, that's not. But again, that's not something you can say definitively. I mean, this may have been. You can have, these symptoms of the thing with anxiety, right? Is anxiety is something all of us have. Like all of us, if you ever, done an exam, and you go in the beginning of an exam, and right before you're about to go into the room and do the exam. I mean, this is, I guess that's how they do them even now. But you, your heart starts racing, your palms get sweaty, right? Your forehead you start getting these cold sweats. You can hear your stomach like growling. You're breathing really fast.
The rising sensation, yeah.
Right. You feel very nervous. You may even get what feels like palpitations, racing heartbeat that you feel in your throat. And then you go in and you start doing the exam, and then all of it starts dissipating, starts settling down, and you start coming down to normal. And now that's anxiety that all of us have. So this could be consistent with that. But then when you have an anxiety disorder, imagine being in that state right before the exam for weeks, months, years. That's an anxiety disorder. So it's a horrendous experience to live with. And anxiety disorders are often associated with panic attacks. You can have panic attacks. So there may have been there may have been some sort of psychiatric thing, with him. And again, this part is actually really hard to diagnose.
So here it says that he would be gripped by feverish conditions, right, or feverish trembling. We were going through when you, like you said, isolating one symptom is hard, but when you start viewing it as them collectively, where he's seizing and trembling, and then he's saying that he'd see angels too. So I would assume that anxiety attacks wouldn't entail visual hallucinations normally, right?
But they wouldn't. Not I don't think not normally they wouldn't, but there's a lot of so a bipolar disorder. When you see bipolar disorder, there's a lot of, historical, just like with, what you said with seizures and epilepsy, there's a lot of people historically, who were extremely successful, who happen to have, the bipolar disorder, generally bipolar type 1. So when you have, if you're in the manic phase of it, then it can be positive experience, really, really positive experience. Sometimes it can be negative, and it can be associated with all of these symptoms as well. It can be associated with hallucinations. It can definitely be associated with delusions. So you can get all of these. You can get symptoms of psychosis in bipolar type 1. In bipolar type 2, you have hypomania, which isn't. It's also really intense. You have a lot of the things that you have in mania, but you don't have the psychosis thing. So you won't have the hallucinations and the delusions and things like that in bipolar type 2. So
considering that they're talking about the first revelation here, do you think the psychosis Muhammad ensued after he tried to kill himself and stuff, and this within a very short time where he experienced this complete upheaval emotionally, would that be consistent with what you would see sometimes in let's say in psychotic patients who are after seizure-like states?
This is actually, it's completely compatible. And I would say compatible. I'm not going to say it's a diagnostic of, because again, with a lot of psychiatric disorders, you can't diagnose a patient from a distance, right? And again, I'm not a psychiatrist either, but I know that much that you're not supposed to. I mean, everybody knew that Donald Trump had narcissistic personality disorder, but nobody was going to go and say it on camera, because you have to examine them just as an ethical principle. But is it compatible with the manic phase of bipolar type 1? Absolutely. I mean, this is exactly what happens.
Okay, that's so cool. Right on. So what we'll do is we'll continue the slides. I'll go on to the next few ones, and then let's see what happens. So another thing we see again and again is this one is Hashia Konuni, where he again repeats the word, the paroxysm of revelation, where Muhammad would be taken over. And then later he goes on about intensity of the revelation. And we'll see this word keep repeating. Now let's go to the next one. And this is something where it gets very, very specific. So here it says when the revelation came to him, he was gripped by severe trembling convulsion, and he would go red as though it had gilded him in deep color. And he would lower his head onto his lap. So from that, reading that, it seems like that is a very clear indication of seemed like a seizure. Now, the detail, the color change. Ali, can you describe why that would be happening? Maybe
you can have flushing. You can I mean, flushing of the skin is something that's known to happen in seizures. So you can have that, just increased blood flow to the skin. I mean, that can happen when you're, I mean, that it can cause warm skin. The warmth can also happen. So yeah, absolutely.
That's so interesting. That he's red and he's feverish and he's trembling.
Yeah.
But I find like the words they choose is very peculiar because given 7th century Arabia, I mean, that's the best they could have come up with, right? Like, how explicit more can you get than them saying he's shaking violently? Like,
yeah, I'm curious about like the trembling and convulsion, because convulsions is a very specific term for seizure, right? I mean, convulsions is almost a synonym for seizure.
Exactly. Well, actually, when you keep going forward, we'll come to the more explicit where they're just saying he would be seized by severe trembling. Like, I'll repeat the Arabic words too as we go on. Let's go on to the next slide, which is Kitab al-Maghazi. Now, this one's interesting because this is one of the earliest books available on Muhammad. In fact, the Kitab al-Maghazi predates Ibn Ishaq even, I believe.
Oh, really?
Yeah, and I wrote the names of the 3 scholars that translated it. So they say that when the messenger of God returned to his house, he sat at his door and we sat with him. A convulsion seized him until we thought that he had a revelation about it. He regained his composure and sweat dripped from his brow like pearls. So that's very interesting. And again, like the word convulsion is pretty explicitly stated there. That he had a revelation. And again, it's followed by the sweat dripping. So it's kind of like you said, like the temperature of the body raises, and as the seizure starts to spread in the autonomic nervous system, right, you'll start to feel the sensation of heat. Let
me correct one thing. So I like fever is not, I don't think it's typically associated with seizures. I'm sure it can happen, right? A lot of things can happen, but it wouldn't be fever. But what I was saying was that when you have facial flushing, that means that the blood vessels that are close to your skin are dilated, and there's a lot of blood flow happening right under the skin, so your skin can feel warm to the touch. You know what I mean? Right, because there's a lot of blood flow very close to the skin, but it's not. That doesn't necessarily mean that if you take your temperature, then you're going to have a fever.
Okay. So there's a thing I came across which was ictal hyperthermia. Could that be related with the skin turning red or the sweating? Because it's like a hot flash happening at the same time, right?
Yeah, like a hot okay, there you go. Hot flashes, what I was saying. When you have the flushing and everything, you can have, and you can feel that way. Yeah, of course, that stuff can happen.
Okay, that's so cool. All right, let's move on to the next slide. And this is a book by another scholar of Islam. It's Daniel Peterson, and he writes in his book Muhammad, the Prophet of God. Here he says, in a late passage, the angel Gabriel is identified as having delivered the Quran to Muhammad. Frequently, when revelation came to him, he would undergo violent trembling, seeming attacks of fever, and severe chills. So here they describe the fever, which would indicate a high temperature, but then he's also chilled out, as in like cold, or maybe he's shivering. Now that could be from a convulsive state as well.
Well, attacks of fever happening in a short period of time, or I don't think that's. I think there's an observation of that maybe he felt warm. I doubt they had thermometers or forehead scanners. But so I think that there were because you don't really get attacks of fever, but when you do have a fever, you get chills, right? I mean you've had that. When you have a fever, you have a high fever, you're going to start feeling cold, and you start having chills and rigors, and
So that's interesting that Allah would give him fever and chills to give him the Quran. Like, the Gabriel's coming, oh boy, here comes the feverish chills.
Yeah, he could have just done it. I mean, it's look, man, they're just over looking at it from a bird's eye view. The weird thing about this is that, he's not talking to somebody who can't figure out how to put a revelation in a dude, right? I mean, you're talking to God. So God wants to do it. God could have given him revelations just with nice symptoms.
Exactly.
Yeah, he could have ejaculated every time he got a revelation. I mean, you're God. When you're Allah, you can do anything you want. You know what I mean? I know, just we're talking like all this.
There's a funny comment.
But but Allah chose to give him seizures, which I think is peculiar. It's a very sort of human thing to think that if you want something really, really important, then you have to suffer to get it. You have to suffer to get it. So he's going through these horrible, horrible symptoms just to get a revelation, as if, Allah can't figure out. He's like, oh, how do I give him the revelations without him suffer? No, he's got to go through a seizure to do this. I can't like
there's so many patients that would sometimes describe ecstatic feelings or feelings of euphoria and stuff, right? During seizures, where they give up everything to be in that state sometimes.
No, that's true. Like, so the manic phase of, that's a good point. Manic phase of bipolar type 1. You do feel really good. You can be just on top of the world and you can feel amazing.
Feeling like God.
Yeah, I feel like God.
I just want to read this comment. That was kind of funny. I think they say peace be upon him because he was always in distress.
Earlier, like the people were saying, like the revelation, like if you get closer to God, it makes you more susceptible to being seizing and stuff, right?
Yeah.
It says after, like he said, like he suffered great pain, sometimes feeling as if he had been struck with a severe blow, heard loud noises, and even on very cold days, sweat profusely. And then they go about like him being wrapped up in a mantle, like a blanket, and then having shaking and being scared, or then people accusing him of being possessed because of seeing all these things. Kind of fits in because when these people are in Mecca are seeing this guy like have these weird episodes and stuff, they're gonna say something, right? And like we talked about earlier, where we had like 10 verses or something talking about his mental health. But this is, by the way, just to indicate, this is a non-Muslim source. This is another secular writer writing about Muhammad's life, I believe.
Well, I mean, I was actually just going to ask you, weren't there, I don't know if they're contemporary, but weren't there, you guys would know this, so correct me if I'm wrong, weren't there like or non-Muslim historians who did describe him as an epileptic?
Yes. So we had this. It started off in like way back Theophanes, I think in the 9th, 10th century. Even the Greeks were talking about him being epileptic back then. Predominantly, the references are Muslim, but when there are different scholars, I will point out. But there are Dr. Dede Korkut that we've been referencing extensively throughout this series. He's a 40 years experienced Turkish neurologist, and then Dr. Abbas Adlian, who's been showing up in the video interviews and stuff throughout as well. They both actually wrote books dedicated to Muhammad's epilepsy. But yeah let's move on to the next slide. Now this is where it gets like straight up. I can even read the Arabic to you, where it says, وَكَانَ إِذَا نَزَلَ عَلَيْهِ خَصْتُهُ الرَّعْدَ. So whenever the revelation descended upon him, he was seized by trembling. So that's pretty explicit, where and associating like revelation with trembling. And this is from Dar Manshur, and he's talking about the tafsir of Surah Duha. Now, this will actually be a continuingly repeating one. And the next one is interesting because he adds an additional phrase where he says, every time he heard the voice of the angel and looked upon him, he was gripped by tremors and fever. So now this one is kind of like saying like, okay, Muhammad is sitting there and he just like heard a voice and he looked at the angel and then he just kind of went into a convulsive fit. Which is very, very interesting. And this one's like adding the fever word. So I don't know if their description of a seizure might be the addition of the fever word, or they're talking about his flushing and the sweating being the fever.
I'm wondering if this is something that's possibly lost in translation as well, because I mean, when you talk about having a fevered temper, right? This is someone who has, even in English, someone who's got a really hot temper, like they talk about a hot temper or fevered temper, then it can just be something that's really, really intense or really angry or really aggressive. So, it may not necessarily mean, a rise in the body's basal temperature. It could be, you're sweating. It's cold, but you're sweating. You get cold sweats. So you're like, okay, that's, someone could look at that and use the word fever. Someone could say, okay, his face is flushing, right? There's a, like they call it, what you said, hot flashes, and you have a lot of blood flow just under the skin, you know, superficially, and when you touch it, it's warm to the touch, even though it's not a rise in basal body temperature. So it may not be the medical fever that we talk about when you actually have a fever because of viral infection or whatever, but it may just be a description of just a figurative description of what they were seeing. But I think the trembling, and when they say seized, that is something that historically in other situations, seized, possessed, taken over, like these terms are associated with people used to see epilepsy. Epilepsy is a very, very striking thing to witness. To watch somebody have a seizure is extremely scary. Okay, so I mean, it's interesting to me that, you know, in his case, like, he was getting revelations. There are other people who used to have epilepsy before, and they were thought to be possessed by demons. You know, so people have had all kinds of different interpretations of this, but I think there is enough documentation in all of these sources that you have. The trembling and this being seized with tremors and trembling and the snorting and the frothing at the mouth. I mean, all of these things are very characteristic of seizures, and you can have seizures with epilepsy. You can have seizures without epilepsy as well. So it could have been, but if he had continuous seizures for, you know, a long time, you know, he may have been epileptic. And then some of the other things, the visions and the hallucinations, the delusions of grandeur and everything, they seem to be associated with the manic phase of bipolar type 1.
Okay.
So there are, and you know, both of those things can happen together. Actually. Exactly. And often they do. Yeah. So
right on. Let's move to the next slide, and we have another one. This is gonna be Hashia Savi from Tafsir of Jalalain. And this one, they're talking about Surah Duha as well. And again, they go, and whenever the revelation descended upon him, he was... So the word they kind of use here is interesting, because we use this in Urdu as well. Istiqbal karna kisi ka. So it says
istiqbal.
So he's greeted or overtaken by trembling. The next word is for thundering or trembling. So very interesting that he
I was just saying overtaken, like possessed, you know, seized and overtaken. Yeah. Like that's a very common way of describing seizures in the past, in historical.
Exactly. And what would you expect 7th century Arabs to describe if they were to see a seizure? Like he was severely seized by trembling, right?
Yeah.
And all that. Right. So continuing on our additional evidence, we're going to have another source, Ibn Adil. This is a Tafsir Bab fil Ulum al-Quran from Surah Muzammil. And this one again says the same thing, that he would hear the voice of the angel, and he looked up upon him, and suddenly he'd be seizing. So this is an interesting one where sometimes you'll see patients, like they'll turn their head and it's like localizing, because like left side, if the seizure starts, you turn your head to the right sometimes, and vice versa. And then they appear in videos, we'll see later, that as it seems like they're looking at something, and then they'll have the secondary generalization and they start trembling. So this is kind of similar to that, but I don't know if this is if somebody saw him turn his face. We don't see that additional detail, which direction he looked up in, but it's very fascinating.
It is.
Right on. There we go. Now we have another one. And whenever he was greeted, overtaken by trembling. That's the same one. He just repeated the narration. So what we'll do is we'll kind of go through these quickly, because these are a lot of the same one, but just to substantiate the point that this was happening with him. Another one is Qayab. I don't even want to read the name. It's transliterated. Says, by Damiri, seized by trembling. This one actually adds something. He says, Tara'ad, which means the Prophet came with his beard trembling. And whenever the revelation came, he would be seized by trembling.
Okay, so yes, some of these sources are, I mean, this is a little strange. I mean, imagine if our friend Abdullah Samir, you know, came into a room and he was completely still, but his beard was trembling. That's a strange vision, right? So I don't know. I think that whoever's documented, a lot of times there is the eye of the beholder too. So that's a very strange description. Like I can see what they're saying, that he's probably shivering and you could see his beard trembling, I guess. But
could it be bruxism during his seizure or something like that?
I don't know. Like that's it could, like, I'm not saying it couldn't, but I think this is not enough to go by.
Okay.
Like, you know,
right.
There's a lot of really, I think, rather than, I mean, you have a lot of stuff here, right? I mean, there's a lot of these documentations. In the collective, they work very well, and you have a few really, really strong points pointing towards the seizures and the epilepsy, which I'm completely on board with. But then, some of these things we have to allow for
benefit of the doubt.
Observers,
and where speculation is needed. Exactly. Because like I see actually a good point where we have the same incident where he's seizing with the camel sounds, but one narrator says he would take deep, deep breaths. One would say he would have heavy snorting, and one would describe it as a camel sound. So you get three different people describing the same thing with three different types of wording, right? There you go.
So that's the kind of thing I think that is more robust. So I would it is, I think it's a good exercise to have all of these things, and I think it's wonderful that you're doing it. But it would be good to take some of the strongest examples that are the most specific and concrete and that are corroborated, right, by different observers. And I think that would make a stronger case. The beard trembling thing, I don't know. I don't think you can find a lot of medical textbooks that say, "Oh, then your beard will tremble." It's not gonna happen.
I don't know how big his beard was and how much was it. Like just clattering the teeth, because we do have a section where we do talk about clattering the teeth, like you talked about teeth grinding might happen. But that's interesting too. So going on to the next one, that's the same guy. He repeats the same reference again just to solidify that they and scholars have written extensively about this, and that we have a lot of evidence to show that Muhammad was seizing or trembling and stuff. But let's move on to the next one again, Kitab al-Maghazi. That's one of the earliest one, again, the one that predates Ibn Ishaq. And this one, it says again, when the revelation came down upon him, is extremely distressing for him. He would turn away behind us and he would cover his head with his thawb, which is like his cloth. And that would continue to be intensely distressing for him until we knew that it had descended upon him.
This doesn't sound like a seizure to me.
But it's very interesting, like when they say that they're just describing like he'd be extremely distressed and then he would cover his face and stuff. It's just bizarre. So
this is one of those things. I mean, if you really, I don't think we should really speculate on this too, just for the sake of credibility, because there's so many. Again, when you have a lot of sort of robust pieces of evidence, you don't want to get too taken away with this. But this just seems like is it consistent with a panic attack? Yes. Is it consistent with, sometimes there's malingering? I mean, there's happening as well. When you notice that when you go through a seizure or something that happens, I mean, it's very malingering is this thing like when people do kind of dramatically, fake symptoms to get attention. So I mean that can happen too. But this would be the reason, like as seizures are involuntary. You wouldn't have the kind of consciousness and the coordination to be able to cover your head with your thobe and then really be very distressed and then come around and say, "Guys, I got a revelation." I mean, that's a little too coherent and sane for somebody.
Well, it's the thing is like this is just like corroborating the overall thing, right? Where intensely distressing for him, but I don't think it talks about that that until we knew that it had descended upon. So what it's talking about that the people could see the distress intensify in him,
right?
And that they could see, okay, he's probably getting a revelation. So what's interesting, they're connecting distress with revelation.
That's continuous. So again, like it's not a pleasant experience for him. I mean, this corroborates the fact that this guy, like to get his revelations, he was going through a lot of crap. Right? Like he was, Allah was not
nice to him.
Being nice to him. He's like, no, if I'm going to give you the message to give to all of humanity, and I'm going to treat you like crap while I do it. There was a strange kind of S&M type thing happening.
There was an interesting comment where I don't know why Angel Gabriel was squeezing Muhammad like a ketchup bottle.
They wrote ketchup bottle? These guys?
No, comment.
I was just going to convert back to Islam. Like they mentioned ketchup in the wow. That would be a miracle. We should all be Muslims if they did that. Everyone in the world.
I was going to leave this one question here. Aimless walking and pulling on clothes. Isn't that common in partial seizures? I don't know if anything about this. So is that common?
They rhythmic, but
the pulling on the clothes. I mean, if you have contract, it is again. So what we do is so this isn't in pathology. What we do is we're sort of commitment phobes when we're talking about a diagnosis. You have to be very specific. If you have clear evidence of a diagnosis, then you can say that this is the diagnosis. A lot of times you have to say this is consistent with a diagnosis of whatever. A lower, if you're a lower level from that, from consistent with, would be compatible with. Like, this is compatible with this. So I think this would fall under the category of, let's tell you if they're close. Yes, this is compatible with a seizure. Okay. And then you can say, if you want to be even less committal, you can say this is suggestive of a seizure. So these are sort of common diagnostic terms that we use to communicate how confident we are in, or how they have with these symptoms, and you have specificity as well, right? It's some symptoms are very, very specific to certain conditions. So, and for example, delusions of grandeur, you could get in a lot of situations. You can get them in temporal lobe epilepsy. You can get them in a manic phase in bipolar 1. But typically they're very few conditions. So they're very specific to a few different conditions. Whereas something like, hallucinations, like they can happen in a variety of different conditions. So
right on. That's it. Now we're going to go to the next slide. This one's actually written by Carl Fander. He's a Christian scholar of Islam from the subcontinent from the 1800s. And he wrote this book and he published it in Arabic, but his translation said that he still had the disease. So initial thing was that before the Quran even was started being revealed to Muhammad, he was trembling and having these people, faith healers, come to him to exorcise him. And he then describes that he would become unconscious for a time, that he would tremble, his eyes being closed and his mouth foaming, and that he would bellow like a young camel.
That sounds like a seizure.
Again,
that's much more robust.
Exactly.
Like foaming at the mouth, grunting like a camel, like eyes turned, closed or turned upwards. Like those kinds of things are, those are pretty characteristic of a seizure. And I think there's several descriptions like that.
Oh, yeah.
And this is saying before he received his first revelation.
Yeah. So he would go through this, and when the Quran was revealed, he started having the same things. So I think whatever was causing his seizures or something persisted and was there before he actually claimed prophethood. And I think that Varaka guy, that a priest, had to do a lot of convincing, or a little bit of convincing, for Muhammad.
Right.
Next on, he goes that...
Hold on. Oh, sorry. Finish this, and then I want to ask something.
Again, in the same book is written upon the authority of Aisha that when Gabriel descended to him, he would become exceedingly oppressed. The sweat ran off his brow. His eyes became wild, and sometimes he would bellow like a young camel. And also upon the authority of Zayd, at the time revelation descended upon him, he became as one in great agony, and then losing his senses, he became as one intoxicated. Abu Huraira says, while the revelation was descending to him, none of us could look up on him because his mouth foamed and his eyes closed, and sometimes he would cry like a young camel. So this guy brought in like 2-3 different narrations that kind of all bring together all the symptoms in one. And when you look at it together, it's quite clearly, that was a pretty clear seizure.
Right. Yeah. No, I agree. I agree with that. Those things are quite, when he says, it's interesting that his eyes became wild. One of the things that you get is you get the upturning, right? I'll see if I can do it, like something like this. Can you see?
Oh yeah, that's actually
the whites
that's
of the
Undertaker
eyes. Yeah, the Undertaker eyes. So that that actually happens in people who have seizures.
That's so cool, because there is a hadith that when he was before prophethood, he fell on the ground with his eyes rolled up towards the sky, and he thought that an angel had slapped him for taking his shirt off.
Oh, really? That's what he thought it was?
Yeah.
Right.
We covered in part 1. It's pretty interesting.
Yeah. You didn't highlight this part, but this is interesting too. Now, according to these and other accounts, there can be no doubt that Muhammad was subject to fits of epilepsy, for the symptoms above mentioned are exactly those of that disease, right? Just a couple of things I want to quickly highlight that was here. Where was it? Oh yeah, I thought this was a great comment. All you need for the point to be made is that it's a plausible alternative explanation to prophethood. An actual diagnosis is not necessary. So Ali, I know you're trying to be fair and to be very precise as a medical, because we're putting you on the stage as a medical doctor.
Yeah.
But we're not going to be able to make an actual medical diagnosis, of course, without him being there. So I think what we're trying to do is to give a plausible, presentation.
Most tenable idea. Yeah.
Yes.
Yeah, with that, I'm completely on board. Like, and you guys know this. I mean, this is something that, that's why I'm here, is that everything that he went through, right? It may not be, I mean, we can sit here, we can talk, like, is it epilepsy? Is it seizures? Is it different? Is it panic attacks? Is it mania? It could be any of these things, right? It could be, it doesn't seem to have the whole, schizophrenia, like, might be a little bit of a stretch overall, but like any of these things it could be. So yes, is there an alternative explanation to prophet? It's actually a very, very likely alternative explanation. Like the idea that, like the fact that he was sitting here getting revelations from the supernatural, who felt like this all-powerful, omniscient, omnipresent being decided to like make him suffer to get his messages. If you want to communicate something to somebody, like you want to tell Samir something, and you want it to be very clear, and you want him to convey your message to all of humanity.
Yeah.
Like, are you going to go and like kick him in the nuts every time you're like, okay, yeah, can you tell this to everybody? You're not going to do that, especially if you're a deity, right?
That was a good one. Kick him in the nuts. Like, Gabriel comes and there you go.
It's like so anti-Pavlovian. It's like the exact opposite of what Pavlov is. It's like ridiculous.
Oh, that's hilarious. That's a very good way to put it. All right. Let's get to the next slide.
So with all respect to your nuts, Abdullah Samir. I mean, I didn't mean it was just an example.
But I just gotta add on to what he was trying to say, that even the first presentation I did last year and this one too, what we're trying to tell you is we obviously cannot sit there and, diagnose Muhammad with pinpoint that, he had a lateralizing focal origin on the left mesial temporal lobe with secondary generalization. We can't do that without genetics, MRI.
You sound so hot when you say that, Gondal. It's great. Say more slowly. Yeah.
So EEGs, MRIs and stuff, or genetics. What we can do, though, is, given what we have here, make the most probabilistic conclusion that yes, there was something neurological at play for sure. What exactly was it? We don't know. We can't know if it was a tumor causing it, if it was a lesion or scarring from an infection he got in his childhood. Was it encephalitis? It could have been head trauma, could have been multitudes of causes, right?
Yeah.
And that's the thing. Epilepsy is mostly idiopathic, but what we can show is that his revelatory episodes really seem to be very much like epilepsy rather than actually God kicking him in the nuts every time.
Yeah. It's like, sorry, go ahead, Samir.
No, you go ahead, then I'll go ahead.
No, I was saying that I think that's that's right. I mean, it reminds me of the conversation that was around near-death experiences. I think was it Raymond Moody, or he wrote the book about near-death experiences, how people see a light and they see, they feel the state of euphoria. People who almost die and they get really, really close and then they're resuscitated. They describe these experiences and their out-of-body experiences, all kinds of things that are very consistent. Like a lot of different people in different situations across different cultures describe very similar experiences who've been to the brink of death and back. So, and then now we know that all of those things, everything that they've described, can be explained through neurology. I mean, these are all symptoms that can be explained if you're hypoxic, if you're not getting enough oxygen, like the states of euphoria, seeing of lights, all of that can be explained with it. So is there a plausible explanation for, an alternative explanation, as you said, a plausible alternative explanation to near-death experiences where people are, they're actually going through a sort of some neurological abnormality or something like that? Then yes, that there is. And now we know that it's probably more likely that's what they're going through.
It's because of the similarity, because everybody's brains are somewhat generally wired in the same way, right?
Yeah. And if you have, and it's very simple. Like if you go through hypoxia, for instance, right? Or lack of oxygen to the brain. I mean, there's certain things that, like every living thing, not just human beings, every living thing is going to have some common symptoms that are going to be associated with that. And when you come back to life, you're resuscitated, you're going to remember them. And you may ascribe meaning to them that isn't, we do that. I mean, the neurology and like neuropsych it's a very, very mysterious field. And we have a lot of strange things that happen with our brains that don't, I mean, I can give you like one quick example of if you have a stroke, for instance, in a certain part of your brain, like for instance, there is, when you see something, like whenever you see something, you know how you see everything reversed and then the brain switches it around and it's all upside down and mirrored, and then it goes into the optic chiasm, and then it goes to the back of your brain in the occipital lobe, right? So the occipital lobe, you have a primary visual cortex that actually records the image like a camera. Okay, you see the image. So I'm holding a ball in front of you. So you're going to see the image and it's just going to have the imprint of the ball. Then there is a secondary visual cortex that's right next to the primary. The secondary visual cortex tells you what that object is. So it tells you there's a ball. Okay. Now imagine if you had an injury in just the secondary visual cortex on the right side of your brain. Okay. Now the left visual field is what the right side of the brain sees. So if I put a ball in front of you in your right visual field, you'll look at it and say, okay, yeah, I see it. I just don't know what it is. And then I move it to the left side, be like, that's a ball.
It's kind of like the split brain patients. Yeah.
Yeah. So you can have, so the brain can do amazing. Now, if you see that in a patient and you have no idea how this happens, you don't know about the secondary visual cortex, you don't understand what the neurological anomaly is here, then that would seem strange to you. It's like, how come this person cannot recognize things when I put them here and I just move them to the other side and they can tell you everything. So there's I mean, that's just one example. There's many strange things that can happen depending on different, where in the brain you have an injury or whatever. There's and it's very confusing to people. It's also a very new field. I mean, I think right now is the age of neuroscience, so we are looking at history. And I think what you guys are doing is the reason it's so interesting is you're looking at, like the 19th century was, the age of chemistry. The 20th century was the first 2/3 of it physics. And then the last of it was, genetics, the genetic revolution. And then now I think the 21st century, a lot of this is really about solving the hard problem of consciousness, about neurology, psychiatry, trying to, figure out what a lot of these mysteries are. And I think that, now we're looking at things in the past and we're looking at these historical figures and we're finding out that a lot of these things that we thought were just magic or strange actually have a lot of organic, pathological, they make a lot of pathological sense.
That is so fascinating.
Yeah.
I was going to just add one thing. Thanks for that, Ali, which is that it's quite possible that some of these incidents were actually pre-planned. Not all of the incidents had to be like organic seizures. Like, when he says that, he was, just before, this was going to happen, he was looking sad, he covered his head or whatever. It's quite possible that in some of these cases, he was actually making it up.
Yeah.
I mean?
I think it's very likely. Because look, I mean, again, imagine this. Imagine throughout your youth, you're getting these seizures and you have the camel grunting and all that stuff, baby camel stuff. And you're doing these things. And suddenly, like, they start getting associated with revelations. You start having sudden sort of visions and things like that. And you start explaining it to people. And then your wife's like, oh, I believe you're the prophet of God. And then everybody else is like, oh, I believe you're the prophet of God. Now suddenly you're saying, okay, whenever I get these revelations, it seems like I'm the prophet of God. And then one day what happens is your adopted son, you really like his wife. Okay? Like Zed bin Haritha, you really like his wife.
Yeah,
and you're like, okay, I wanna marry her. And Zed is like, okay, fine, I'll divorce her. But you can't, he's like, this is my son's wife. I can't do it. It's like, but he's adopted, so I need something. Like, I need something. What do I do? You can't just bring on an involuntary seizure. So then, yeah, you're gonna fake it.
Yeah, that's the
men
biggest
have done crazier
example.
things. Yeah,
that's the Zayd story is one of the the biggest
actually
examples.
Like the convenient revelation, right?
Yeah, exactly.
That one is funny because we have a video of a person called I think it's Wayne Bent. He had a cult in the modern day, and he ended up marrying his adopted son's his real son's wife because God told him to, and he describes
no,
his thing.
He didn't. Yeah, he had sex with her.
Yeah.
Okay.
And then he said he laid on the ground and he had this revelation, and then he got up and he was smiling and he told the world about it. And it's kind of funny because the exact same thing happens with Muhammad. It's just so funny. I just want to show it to the people. Slide 154. I mean, you'll have a great laugh on this one.
Poor girl, man. Things these guys used to do.
Yeah, not the girl, the husband too is really upset, like disturbed by this.
Yeah, it's upsetting the husband. Like,
yeah, that one. So on the right side, you see Tabari, right? Okay, he's describing what happened to Muhammad. So we'll just go through that first. While the messenger of God was talking with Aisha, a fainting overcame him. When he was released from it, he smiled and said, "Who will go to Zainab to tell her the good news, saying that God has married her to me?" Right? And then he recited the verse, and remember, Muhammad, when you said, "To whom Allah bestowed favor, keep your wife," and then
oh man, I was born in the wrong time. This is great. You just like somebody, you could just get a revelation and get married to them. It's awesome.
Now, at the bottom of the Tabari thing, he actually footnotes it and says Arabic word ghashiyah, a swoon or fainting spell, literally a covering here, signifying an episode of revelation happened. Now, keeping this all in mind, I just want to watch that little video of this guy. It's gonna be it's like he read Muhammad and took it out.
My time here, I thought I'd heard everything. Then Jeff delivered an incredible revelation about his dad, the Messiah.
God came down on Michael and forced him to consummate with Christiana. I mean, it was a terrible, strange act of God. He did an astonishing thing that I was astonished, and so was Michael.
So
Michael had made no mention of sleeping with his son's wife. And I got the feeling this was a story I wasn't supposed to hear. And when Michael found out I knew, he asked me for an opportunity to explain just how God had made it happen.
I stood up like this, and suddenly I was forced down on the floor, and I had to get down. I was down just about like this. And I was in pain, and all I could do was groan. All I could do was kind of rock. And I started seeing that the consummation with Christiana was imminent, and I was going to be, I was going to have to do that.
This guy's got.
I was lying awake, and I was thinking about coming over here. And I said to Father, I said, when I go over there, if Michael invites me in, I will ask for the consummation tonight.
So was it just a single occasion, this literal physical consummation?
No, it wasn't.
But you consummated more than once?
Yes, yes. Yes.
Why is it necessary to consummate more than once?
Oh my god, I love religion. It's so funny. Oh god, this is so good.
It was like as if he read the book and he just acted Muhammad's play out.
Yeah, this is what happens with cult leaders. I mean, it happens all the time.
Dark Age Jerry Springer.
Huh? Yeah, this is what they were all doing. I mean, this guy in it was I think this a sort of Pentecostal minister. It was Dark Age Jerry Springer. It's funny. It was a Pentecostal guy, I think, somewhere in Africa. I can't remember where, but he was making women in his cult just drink his semen. He's like, and if you come in and you He was basically getting head from all these women.
Well,
and just
that's so weird because later on, and we find that Muhammad would actually force his people to like drink and rub his spit on their bodies to get glad tidings. Some people would drink his blood. Some people ate his feces and urine. It was, yeah.
Really?
Yeah, it was
I'm
really
sorry,
weird.
Was I really loud there? Okay, yeah.
But no, it was like with his own, like he had this. I don't know if you know about the mole on the back where he had this big mole with hairs, and it was the seal of the prophethood, apparently.
Okay, well,
it might be a Sunni thing.
Huh?
That might be a Sunni thing.
Okay, maybe, yeah.
Yeah.
But no, it's very interesting. But what we'll do tonight, I think we'll just finish that trembling section, the convulsion section, and then we'll call it. There's like 9 more slides left to it or something.
Yeah, let's do it.
We're like at slide 120, I think.
Yeah, this is a lot of fun.
That video though killed me the tongue.
I need that. I need that video.
You know, Haris actually made a dubbing of that. So he voiced it in Urdu for all the 3 characters.
Haris is amazing. I love the fact that he does it. Yeah.
It was so funny. But anyways, we were at slide 120 actually. So let's see. It was one slide before this one. Right on. So this is Mu'jam al-Kabir Tabrani's book, and he lists out the chain. This one says it's the same where he used to, have his leg on top of the guy and it would press down and create that pressure. That's the same hadith. Here says here, it used to shake him severely and he would sweat intense like pearls. Now that's very consistent with what we've been reading so far too, again, that he was being shaken up or whatnot. So let's go to the next one. And then this is Sirat Halbiya. This, I think, was written in the 1700s, this book, by a big scholar. This is actually like monumental work. It's so huge, so important. Anyways, whenever the revelation descended upon him, he was greeted, overtaken by trembling. And in a narration, it says, he showed signs of restlessness. His face color would change, his eyes would close, and he would breathe deeply like a camel. This camel detail, man, it keeps
this camel,
up. It's like the camel.
The camels. I've never really focused on how camels breathe, and I mean, apparently they've got a lot of stuff going on. There's a lot going on with these camels.
Or Arabs really remember their camel breathing.
I mean, they don't really have a lot of other references. It's not like they have kangaroos and stuff there.
You know, it's something funny here. There's a hadith that says, "Don't pray like a camel," and the funny thing is, Muslim scholars don't know what that means, because the camel, either it means you put your hands down like this or like this first, but like it's ambiguous because camels sit both ways, right? So I remember discussing this camel hadith, and they were like, well, it could mean either way. So I guess, yeah, they're using the references that were available at the time, right?
Exactly. I want to point out something in the Urdu of this, though. It's very interesting. It says, एक रिवायत में ये लफ्ज़ है कि जब आप पर वही नाज़िल होती थी तो आपके जिस्म पर लर्ज़ा तारी हो जाता था. Meaning the guy explicitly says in Urdu that whenever revelation came, he'd be just convulsing like crazy. And then the rest of it, like he would be anxious, restless, and whatnot. Now let's go to the next hadith. Here is Tafsir Fath al-Qadir. This is by Shawkani, and this is written in 1250 Hijrah, so about 1800s. And he talks about the same one, that the prophet was actually going around and he would hear the voice of the angel, and he would look on towards him, and he would be seized or gripped by trembling. And then he would run back to his wife and said, Dhammiluni, dasiruni, cover me, cover me. It's that incident being narrated. That was the first revelation, I believe.
Yeah.
Now, same thing we get again, and then Tafsir al-Munir in the next slide. Just the same repeated twice, the narration, but just to affirm what it is. Then we get, this is a Shia reference in slide 124. Again, they mentioned the beard trembling, and whenever the revelation came, he would be seized by trembling. So they add the same thing onto it again. And what I'm trying to point out here is, why are the Sunni and the Shia corpuses that hate each other so much converging on the same details about his experiences, right? Which
I mean, they converge on a lot of like facts about Muhammad's life. So I mean, this is the revelation thing. This is a very human thing. Like, man, he's getting messages from God, and he's going through just convulsions, and everything is like really scary and mysterious, and you know, it's just, it has to be negative. I mean, this is something that sort of intuitive for human beings to concoct.
Yeah. Well, we have 5 more slides to go. Let's go to the next one. And we have Tafsir Fatah al-Bayan by Siddiq Hassan Khan. This is actually written in 1308, so like 19-something hundreds, this one. And he repeats the same one that when the Prophet, he heard the voice of the angel, he would look in the direction of the angel and again be gripped by trembling. And the word being used here is very important because Arabs, you know, like Muslims are like, oh, the Quran and the Prophet is so precise in the word. This is a linguistic miracle. That's a linguistic miracle. The word is akhaztuhu, which means the same word Allah uses, you know, seize them and throw them in the fire. Khuzuhu fazulu, like vehemently grip them. That's very interesting that they use that word again. And we have Qurtubi, a big scholar. In the next slide, he affirms the same thing. That he was gripped by trembling. And in the footnote, he affirms this is from Al-Imam Ahmad, Bukhari, Muslim, and a few other people. So it's a common narration.
Yeah.
And then the next one is another one from Tafsir al-Qurtubi. But this one is the same guy repeating another narration about his beard trembling whenever the revelation came, and he would be overtaken by...
Is this the same guy who said his beard was trembling in the previous ones?
No, it's a different guy.
Oh my God.
So they're converging all together. Like there's like 4 or 5. The Qurtubi is Sunni, the Asbab al-Nuzul by Wahidi is Shia. They're all converging on the same incident.
This whole trembling beard thing is...
Yeah, it's interesting.
He had a big beard, right? So
yeah. You know, it's one fist beard. Now we have Ibn Kathir, a very, very famous one. And this is in Urdu, actually. So I'm going to read it in Urdu. इन्ना सनुल्की को सनद ठहराया और नुज़ूल वही के वक्त हमेशा आपके चेहरे मुबारक के तगय्युर और गर्दन से लेकर ऊपर के धड़ तक आपके जिस्म मुबारक की कपकपाहट को इसी कौल की सनद के साथ आसार नुज़ूल की वही से ताबीर किया है.
Oh my God, so like
it's so technical, the Urdu there.
Technical. It means they're trying to make it really, really poetic. And I always get suspicious of translations like this because when they make it so flowery, and I mean, a lot of the people listening to this won't know what this means, but this is sort of like a very sort of poetic, exaggerated, flowery type version.
Exactly. Trying to make it sound palatable to the audience, you know.
Yeah.
I did find the Arabic of this, so I had to back check it to confirm that he wasn't mistranslating. But some of them do it once in a while just to make it less bad. We have 2 more hadiths or the screenshots to go. This is a very famous book, actually. This is Life of Muhammad by Hussein Haikal. He's a very famous, I think, Egyptian historian. And it's kind of shocking when I found this one because he just straight up says, like, silence reigned for a while. Nobody could describe it as long or short. Muhammad had not moved from his spot when revelation came to him, accompanied by the usual convulsion. So this is a Muslim, modern 20th century historian in his book saying Muhammad had usually had convulsions every time he'd be having his revelation. And then he says that Muhammad, as for my parents and the Prophet, recovered from his convulsion. Oh, she goes on with that. They looked pale enough to die. After Muhammad recovered, he sat up and began to wipe his forehead where beads of perspiration had gathered. And Aisha claimed whatnot. But yeah, that's interesting that he's saying that this was a usual matter, like everyday thing.
Yeah.
And in some hadith, we will see the words where they will see the state that used to grip him during revelation gripped him again. And that's what they would say and end it with that. Then last screenshot, and we will call it a night. This one is Sharh al-Nisa'i. So this is the explanation of a hadith written by a scholar. And this just adds to show you where he says, Aisha, may God be pleased with him, wanted by this to allude to his enormous suffering, distress, and anguish during the coming down of revelation. And again, like we were talking about, why is God kicking them in the nuts, like choking him, squeezing him like a ketchup bottle to make him get his message?
You've taken this whole kicking in the nuts thing. I mean, like, I think
that's a good analogy.
We need to take that clip out here and just really
It's so cool.
that point home. It's absolutely, because it's true though. I mean, that's the one thing that really stands out for me in all of this is, okay, fine, you know, we're trying to figure out what was going on with him, whether it was a neurological condition, was a psychiatric, what was it? But the biggest thing is, like, you have this powerful deity that's making his own, you know, first of all, the Christian powerful deity went and, like, just killed my son. Go ahead, it's okay. He's like me on earth. I'm sending him down as a son. Crucify him, treat him like crap, like make him die. And you know, that was really important for him to get his message across. And now this guy, you know, Allah, like, he's making his guy suffer just to get his message out. I mean, why make it so difficult?
Exactly. Like, God could have chosen so many ways to talk to his messenger, but he chose the most epileptic of ways, you know, like seizures as a communication. She goes on, experiences hardship, and became overwhelmed by anguish due to the weight which was thrust upon him.
Oh my God, that sounds hot.
For that reason, he was afflicted like one who is in a state of fever. Just that is it related, that during the revelation, he was gripped by intense perspiration. So they're actually explaining that the fever means the sweating. And then there's a meaning strained breathing and sweat from the intensity, and more of that would just call the sweat of fever. Yeah.
So I have to, you know, like, I think that there are certain things here, like, you know, when we talk about the convulsions and the frothing of the mouth, the eyes rolling back in the head or looking up at the sky, that eyes going wild, things like that, the grunting, heart, you know, so all of those things together, taken as a collective, do very compellingly point to seizures. So, I mean, that's not a surprise. Then, you know, there are other things like that just show that he was very distressed or he was very upset. And so I think that there may have been a combination of that. I genuinely think that there was a, you know, he had a condition, some kind of condition, right? Most likely some sort of seizure disorder, epilepsy, and then, you know, some psychiatric issues at the same time. And when he found that these were giving him a lot of sort of a, you know, what they call, he was getting positive reinforcement from these, because people were seeing him as very credible as a messenger of God with these, and his following was increasing and increasing and increasing. And then he had to sort of, I think that after that, there was a little bit of manufacturing happening too. And he may not have realized it himself. But
yeah, he was sincerely, deludedly believing in himself, right? Like, he's actually talking to God. Exactly.
And that can cause distress. That itself can cause distress. You know, when you suddenly know that there's a lot of pressure, there's a lot of people listening to you, it can cause a lot of issues.
Now, I remember in the beginning of the revelation, when he first got the revelation, he himself wanted to kill himself and was distressed about that. And I don't want to, what am I going to tell the people of Mecca? Am I a mad poet or possessed? Right. And they brought it up right away, like we saw earlier, that they had like 16 or 12 verses in the Quran that specifically mentioned the word majnoon, right? Jinn afflicted for Muhammad. So for tonight, I would definitely say that we saw definitively that he had some form of a seizure disorder. We cannot pinpoint where the origin was. That's out of the scope, beyond our scope. It's almost impossible without an EEG or stuff like that. Genetics and whatnot to know, but we can definitely show that Muhammad had what you could call secondary generalization, especially with him saying he would get the aura of the ringing bell. We have today concluded the convulsion section of our thing. We are only at slide 130, and we have lots more to come. So we have like things on clattering teeth is the next section. Then we have a fainting section where he would have syncope, which lasts for about 30 slides. We have, so another thing was like his lethargy and fatigue. So after seizures, you know, you see people kind of like drowsy, drunkard. You see that is exactly what Muhammad went through. And then go into details of his foaming, frothing, and whatnot. But
I can't believe there's so much. I mean, 130 is, you have a lot more to go. How many slides do you have?
400. So if I just give you the breakdown, So 130 onwards to 141 is like all teeth clattering stuff. 142 all the way till 171 is him fainting over and over again. Like he had a syncope problem. Like the guy had a fainting problem. Then the lethargy and the fatigue section goes for 172 all the way to 182 and has Dr. Yasser Qadi pop up and a lot of other interesting snippets. Then we dedicate, so the foaming and salivating one goes from 183 all the way to 192. And actually I was shocked that I found 6 different scholars separated 200-300 years apart from each of them narrating a hadith from Sahih Muslim saying that, it clearly says he was foaming and frothing at the mouth. And then they use Muhammad as the example in the dictionary for the word. And it's just ironic. But they all claim that Sahih Muslim has these hadith. But when you open the modern Sahih Muslim, that hadith does not occur. It changes the letter. It literally, they change the za to the ra with a dot. And that changed the meaning of. So there's a whole interesting conspiracy that I go into. But it's very, very fascinating. The manuscripts have been edited to make him seem less epileptic. Yeah. But lots more head twitching. One thing that was very interesting was one of the doctors claimed that he can somehow show that Muhammad's localization or lesion was on the left side, because there's many incidents where he would be sitting and he would look down to the right side of the ground. His head would fixate and he would move his lips, talk to somebody. Then his eyes would go up to the sky. Sometimes he would generalize. Sometimes he would just forget what happened and ask his friends, "Can you tell me what I just did? What happened?"
Yeah. So it's still hard to localize just based on that, whether it's on the right or left, because you can have seizures. They can be ipsilateral, which means on the same side, or they can be contralateral. So and there's something like him turning to the right to talk to somebody. That's probably a little too vague to definitively see if you can localize it. It's I think that okay, so the conclusions for this, for me, and this is really incredible work, by the way, Gondal. If you got 400 slides, I don't think anybody knew that there was so much information on this, and there's so many mentions of this by so many different sources. So it's fantastic. But I think the only thing we know as a fact, is there is an extremely plausible alternative explanation to his behavior and everything that he did that is nothing supernatural, that completely excludes the supernatural deity speaking to him or giving him messages. So there is not just a very plausible, but a very likely alternative explanation, an extremely likely alternative explanation. Now, the second thing we know is, I think overall with everything that you're saying, all the symptomatology that you've outlined, it seems like he had a primary, primary is loaded language, but his main issue was that he had some kind of disorder. He had some kind of seizure disorder, either in association with or combined with some, maybe, some sort of either mood disorder or a bipolar disorder or something like that. But definitely there was a seizure disorder as a primary thing. And then I think the third thing, it seems to me, is, and that's a little more speculative, is that when he got positive reinforcement for these symptoms that he had when he was getting revelations, it seems like for the more convenient revelations later on, I think that he probably made it up. I think it's pretty likely that he made up some of those other things through the convenient stuff.
Thank you so much for that. That was the really good remarks, and the best way I could have summed it up too. We can only pinpoint that there is sufficient evidence with a high degree of certainty, we can assert even at this point, that he had a neurological component to his disorder for sure, probably seizure. We cannot know exactly where the damage came from. It could have been infection cause. In fact, it's kind of absurd to try to determine the cause because we just don't have the patient in front of us. But from the given evidence, given that how much pride Muslims take in how much detail they recorded about Muhammad, if anybody were to have a diagnosis possible in the highest form of degree in history, it would have been this guy, because he's the most mentioned or the most detailed, right? An interesting thing is we will get to this when we get to the section where we talk about contemporary and famous people, where Dostoevsky, an epileptic author himself, then talks about Muhammad's epilepsy. And then he says that the way Muhammad had a seizure, I have seizures too. So, and then he goes on to like his, that the seizures inspire him to create characters and write in his novels. So that we'll get to that. Then the hypergraphia component to it as well is very fascinating. Compulsive rhyming that Muhammad suddenly showed. Deterioration of the Quran from a poetic to a very prosaic, from a Medina to Mecca. And as he aged, did his brain get more damaged with the seizures? Lots of speculation, but it's very fascinating when you go through it. But thank you so much, Ali Rizvi, for joining us today.
Thank you. This is fun to call me. Like, I would love to be. I want to hear the session with the Dostoevsky talking. I didn't know that.
Yeah, I know it's fascinating. We'll definitely get you on again for sure, but that will be in like part 4 or 5. I don't know at what part we're gonna get to. But no, this is fascinating. It's truly an honor to have you here.
Cool series, man. It's an honor to be here. This is great. You guys are awesome.
And the fact that we can have this discussion in 21st century, and it's now taken seriously by actually, like, there's doctors, like neurologists who've like we talked about earlier, specialized in the field, have noticed that, okay, something might have been up with the dude, you know?
Yeah.
And one thing I want to say is, like, we're not doing this just to make fun of Muhammad. This actually has a historical learning component where we are also undoing stigmas attached to epilepsy, where people think that epilepsy can just reduce you to a dysfunctional vegetable and you can't do anything in society. But when you actually look at it, many great literary giants have been afflicted by epilepsy, neurological disorder. Poets have higher frequency of epilepsy, synesthesia, things like this, right?
I also want to say one thing, that I think that this is rather than mocking Muhammad, I mean, this actually creates more sympathy for him. It humanizes him.
Exactly.
Because it shows that, you know, he has, like, this is a man who had conditions, and there's a lot of conditions you can have that can really make you very high functioning. I mean, people with bipolar disorder, for instance, can be extremely successful. A lot of times they're associated with higher IQs. You know, we've seen that with everything from autism to bipolar disorder to even, you know, so many of these neurological psychiatric conditions are associated with very high functioning as well. So I think, you know, so I think that this does humanize him more. So it's good to discuss
for him. I straight up, like you said, like, it's humanizing. Like, when you're talking about him as a child suffering, and then his seizures and the way Khadija convinced him is him trying to kill himself, being confused, it really makes you think, holy shit, yeah, this was just a poor old guy who was born the wrong time and was fed into his pathology, and he got tricked into believing this whole.
There's a lot of, and he did live at that time. I know a lot of people say that's not an excuse that he lived at. Of course, it's not an excuse for a lot of things, but I mean, he did live at that time. He grew up with, you know what, this guy, his father died before he was born. His mother died when he was like a little kid. Then his wet nurse died. Then his grandfather, he went to his grandfather. This guy saw so many deaths of his primary caregivers, like by the age of like 12 or 13. This guy had seen already a whole bunch of deaths. And then, you know, he didn't really have, he was an orphan, like, very, very early on. And it's interesting, he was kind of progressive. I mean, his Khadija, like, everything was the opposite. Like, she was older than him, she was divorced, she was not a virgin, he was. She proposed to him, she was his employer, she was his boss, she paid him. I mean, it was like a feminist wet dream. Sorry, but that's you know, so there are really interesting progressive elements about his biography that I think we can be sympathetic to. We can admire him. He's a complicated creature of history. It's you know, we admire Thomas Jefferson because Thomas Jefferson, nobody claims that he's infallible. Thomas Jefferson, when he was 40, did he impregnate a 14-year-old slave? Yes, he did. He did a lot of those things. But everybody knows that it's wrong because they can say he doesn't claim infallibility. So we're allowed to, we can look at the good without. So I think it's the same thing. If we treat him like a regular historical figure without the infallibility and without the infinity, then you can sympathize, you can learn a lot from him, and you can learn about how people thought at that time. I think it's a much more interesting way to look at things.
Yeah. No, this was truly a fascinating episode. Like I said, he's an anthropological figure, and we need to bring it out just for, from social perspective, social sciences, humanitarian sciences, learning history and how it impacts, or how misunderstanding this could go south, like we've seen. But no, thank you, Samir, as well, for having both of us, giving us the platform to talk about this. This was a fascinating discussion.
And your commenters are awesome because, like, I saw one guy wrote, he's like, "Are these slides sahih?" Like, that's
we got a good audience here, and thank you for summarizing that. That was really well said, Ali. Abdullah Gondal, really, excellent conclusion to the topic. And we'll end it off on there. Just to say a couple of last words. Thank you all for joining. Thank you to the Friendly Ex-Muslim family. The channel is at 18,000 subscribers now, so it's growing well. It's back on its way to 50-60,000 like I used to have before. If you'd like to support the channel, please do consider joining it. Click join now below, or join on Patreon. Both would be most supported. Both would be most appreciated. I'm trying to say this as quickly as possible because it's midnight now and I'm tired. But this was awesome. Thank you, Ali, for your perspective as a medical doctor. You were our favorite medical doctor, not Dr. Zakir Naik, but Dr. Ali Rizvi is our favorite medical doctor. Yes, I went there. Yes, I did. And as well, do check out Ali Rizvi's Professional Novice and Secular Jihadist. His two channels that he's working on, one by himself, the other
we
one
have
on
Secular Jihadist tomorrow night. If you're a patron, you get to see, we have Infidel Noodle on. Infidel Noodle.
Oh, yay.
So she's coming on. It'll be me and Susanna from the CEO of Atheist Republic, and we'll be talking Infidel Noodle. So that's going to be really wild. I'm looking forward to that.
Awesome. And if you guys haven't subscribed to this channel yet, you need to do it. I will be linking to the first episode of Epileptic Prophet as well, so you can get the link. We have all of the references for the first part done. So someone is helping and going through all of the references one by one and pasting them. So they'll be added to this show as well. You just have to wait a while and it'll be there as well. Okay, thank you everyone for joining, and to my special guests, and have a good night. We'll see you at part 3.
Part 3.
Science Hafiz.
Science Hafiz.
Stay away from Islam.